Thomas Walker's on the line.
Georgia Halone is on the line.
Good afternoon, everyone. Thank you for calling back in. Sorry we had to recess, had to fix some things here within the IT world, and everything is good to go now. With that, let me go ahead and call this meeting back into session. This 24th Navajo Nation Council summer session. Today's day 2, July 21st. The time now is 3:27 p.m. I am here in Winter Rock, Arizona, in the Navajo Nation. We do have my colleagues surrounded throughout the Navajo Nation via teleconference. Presiding is myself, Seth Damon, Speaker of the 24th Navajo Nation Council. Let me go ahead and call this meeting to order, back to order at 3:27. In order for us to do that, we'll go ahead and need a roll call. Make sure we have a quorum. With that, Ms. Uvella, you get a roll call vote. Or excuse just roll call.
Honorable Elmer Begay. Honorable Elmer Begay. Honorable Elmer Begay did not answer roll call. Honorable Key Allen Begay Jr. Honorable Key Allen Begay Jr.
You're gonna answer another call?
Honorable Key Allen Begay Jr. did not answer roll call. Honorable Paul Begay Jr.
Delegate Paul Begay is present.
Honorable Paul Begay Jr. answered roll call. Honorable Nathaniel Brown. Honorable Nathaniel Brown. Honorable Nathaniel Brown did not answer roll call. Honorable Regina Charles Newton.
Charles Newton is present from Sherbrooke, New Mexico.
Honorable Regina Charles Newton answered roll call. Honorable Amber Knott-Crotty. Honorable Amber Knott-Crotty. Honorable Amber Knott-Crotty did not answer roll call. Honorable Speaker Damon.
Present. I am present.
Honorable Speaker Damon answered roll call. Honorable Herman Daniels Jr.
Delegate Herman M. Daniels Jr. is calling in from Fort Gum Hill, Utah.
Honorable Herman Daniels Jr. answered roll call. Honorable Mark Freeland.
Freeland's present. Thank you.
Honorable Mark Freeland answered roll call. Honorable Pernell Halona.
Georgia Halone is present.
Honorable Pernell Halona answered roll call. Honorable Jamie Henyo. Honorable Jamie Henyo. Honorable Jamie Henyo did not answer roll call. Honorable Vince James.
Delegate Vince James is present.
Honorable Vince James answered roll call. Honorable Ricky Nez.
Delegate Rick Nez is here.
Honorable Ricky Nez answered roll call. Honorable Carl Slater.
Delegate Slater present.
Honorable Carl Slater answered roll call. Honorable Raymond Smith Jr. Raymond Smith Jr.
Present.
Honorable Raymond Smith Jr. entered roll call. Honorable Wilson Stewart Jr. Honorable Wilson Stewart Jr. Honorable Wilson Stewart Jr. did not answer roll call. Honorable Charlene So. Honorable Charlene So. Honorable Charlene So did not answer roll call. Honorable Otto So.
I'm here.
Honorable Otto So answered roll call. Honorable Daniel So.
Daniel So is here.
Honorable Daniel So answered roll call. Honorable Eugene So. Honorable Eugene So. Honorable Eugene So did not answer roll call. Honorable Thomas Walker Jr.
Present. This is Thomas Walker.
Honorable Thomas Walker Jr. answered roll call. Honorable Edison Wanika.
Here.
Honorable Edison Wanika answered roll call. Honorable Ed Miyazi. Honorable Ed Miyazi. Honorable Ed Miyazi did not answer roll call. Honorable Jimmy Yellowhair. Honorable Jimmy Yellowhair. Honorable Jimmy Yellowhair did not answer roll call. Going back up. Honorable Elmer Begay. Honorable Elmer Begay. Honorable Elmer Begay did not answer roll call. Honorable Keala Begay Jr.
Delegate Kealan Gay Jr. Present.
Honorable Keala Begay Jr. answered roll call. Honorable Nathaniel Brown.
Delia Brown is present.
Honorable
From
Nathaniel Brown
KN to
answered
2A.
roll call. Honorable Amber Knapplock Carty. Honorable Amber Knapplock Carty. Honorable Amber Knapplock Carty did not answer roll call. Honorable Jamie Henyo. Honorable Jamie Henyo. Honorable Jamie Henyo did not answer roll call. Honorable Wilson Stewart Jr. Honorable Wilson Stewart Jr. Honorable Wilson Stewart Jr. did not answer roll call. Honorable Charlene So. Honorable Charlene So. Honorable Charlene So did not answer roll call. Honorable Eugene So. Honorable Eugene So. Honorable Eugene So did not answer roll call. Honorable Ed Miyazi. Honorable Ed Miyazi. Honorable Ed Miyazi did not answer roll call. Honorable Jimmy Yellowhair. Honorable Jimmy Yellowhair. Honorable Jimmy Yellowhair did not answer roll call. With that, Mr. Speaker, you have 16 members that answered roll call. Mr. Speaker.
Okay, thank you. That we have 16 present. Concludes for roll call. We are back in session, colleagues. With that, we did leave off with Honorable Vice Chair Smith. Gave some time over to Honorable Otto So, and then Honorable Rick Nez, who gave some time over to as well. And Honorable Hino, who gave some time over as well. So with that, I was gonna come back to the controller to respond. Hopefully, we don't need to move forward unless if there's some responses, Madam Controller, that you didn't get some questions, I can have the individuals do a recap. But if you wrote down the questions, we can move from there. So, Madam Controller, I'll give the time over to you.
Otto, good afternoon. Ashina Otto Nahojish, and yeah, Speaker Otto, the 24th Navajo Nation Council, Adeta Etnos Taidon, da Adosh Kidigi. Previous to the break, I believe Delegate Smith gave some time over to Delegate Halona regarding the Title 4E. Otto, I did write the questions for Delegate Nez. Chair Henio had some comments, and then Otto Shija, Delegate Otto so had some questions as well. So Otto, in terms of Delegate Halona United Kitigi on the Title 4E, I just want to make it clear that this is a serious matter. So it's not as simple as myself as a controller to draw down the money. It is serious in a sense that for 5 years, a program has not, in essence, circumvent the Office of the Controller and the Office of Management and Budget. So, our respective offices are charged with certain duties and responsibilities per, at least as the Controller's Office per Title 12. So, if our offices do not prepare certain financial reports that are sent to the federal government, audit based on the if that doesn't happen, myself, I have to attest to these financial reports. I have to certify them. And if I'm not given an opportunity to either prepare them or review them, and then anabalate to draw these funds down, in essence, we will break the law. So that is why it's a serious matter. It's not something to be taken lightly. And that is the reason why I insist that I have 19 boxes, 5 years worth of reports that were prepared without our involvement. I insist that we review those and we do our part. So that is why I'm adamant about ensuring that the proper process takes place, the proper review, and so forth before these monies are being drawn down. So I just want to make that clear, and I don't know how else to keep saying the same thing. So what happens is when something like this happens, it's a breakdown in the nation's internal controls. So that is why it is problematic when programs decide to, in essence, put up their own financial processes that is outside of the controller's office. So, so I just want to make that clear. Otto, the next question I have is Chair Nez regarding the special duty pay. Exempt, so non-exempt, exempt kid for the special duty pay. So the special duty pay applies to both exempt personnel as well as non-exempt. Early on, we did have questions on where we had the policies in place. Exempt employees have, because they're salaried, obviously, how to calculate special duty pay. So in the policy, it contemplated a lump sum payment, although just because they're hourly, they would do time and a half. So what the early problems we had was essentially budget issues. So if you take an exempt person, so ADGA, because they're salaried, their rate, if there is a rate, they are high. So when you apply the time and a half concept, then, you know, as you can imagine, those numbers just climb. And so for that, then it becomes a budgeting issue for various programs. So we had some of those budgeting issues. But if a division decides to make a certain lump sum payment using a time and a half concept, I don't really think that's prohibitive, but everybody's just got to be aware that those numbers will climb in terms of special duty pay, especially on the salary, because they have a higher rate than your non-exempt people. So Auto Chair Henio Yaj complimented my staff. Mr. Wanika, I have to say, can you guys hear me still, Atish?
Yes, we can hear you, Madam Controller.
Because I keep getting a message to unmute myself.
No, we can hear you.
Okay, Chair Henio complimented my staff. I'm always in need of staff that are interested in obtaining professional licenses. We don't have enough of those individuals, and Mr. Wanika has been a great asset. Our people, sometimes I have to retain them just to tell them, you know, they have a possibility of getting some assistance in getting them licensed professionally, or trying to give them the experience that, you know, that they can get despite the salary scales that we have here on the nation. So Mr. Wanika has done a great job so far. Delegate Aroso Shigo Naidin Kidasto. I think, as near as I can tell, he was asking about problems with the processes, with our laws and rules and regulations. Eben Naidin Kitashin Ado Abahanas the 164 process. That kind of presents some problems. I think he mentioned the domestic violence shelter situation with social services. So auto nursing homes, it became an issue of contracting. Every year these contracts have to be put in place. I don't into the contract and some of, as part of the process too, some of these contracts they don't have the insurance coverage, and so if we're using federal funds, it can be problematic for the nation in terms of potential liability and those types of things. So we are trying to, I know risk management has been grateful that they are being part of the process. And so, but it boils down to the 164 process. Right now, per the executive order, the Office of the President and Vice President has the discretion, you know, select who can review some of these contracts. And so if we're not involved from the Office of the Controller, then I thought that isco you that bikero into the aya nehahin so ado bikero into the quila insurance abe that no aya benina aya satahanda kid. And so that can be a problem. And so the 164B is really our internal control station. Shashkide hatahazito hajobi kaho etol nashiki ediki baby, that's in Sinolia. So, digi oyon dige, so then there's a lot of things that we find out after the fact. So that can be a problem, especially on these contracts. They're providing the nation services. So if we don't have a contract in place, then obviously from the onset of when these services are provided, then oyon non so if there's no insurance coverage, then hey, liability. So there are some areas of concern that present these types of problems. So AJA Social Services do domestic violence shelter behind the edigi beninache eya akut out in the auto. I think lastly, with the reimbursement to ourselves, I think the low-hanging fruit, I call it, I think that's, as I mentioned, a kutao, aja, based on Dehigi, we can use the CARES Act money to reimburse ourselves and free up the unrestricted dollars that can help us going forward, even into the first quarter of fiscal year 2021. So I believe I hit the various questions. So
Okay, with that, let me go on back to Honorable Yellow Hair.
Hello, Yate.
Oh.
Can you hear me, speaker?
Yes.
Okay, Yate, Nanisho, Aro, here, Shazeredi, Nahod Nike. Allah, he covered a lot.
Honorable Yellow Hair. I'm
Yes.
coming to you. I'm coming to you because did you have a point of order or question of
Point of
privilege?
order. The point of order, or point of privilege, either one. Or I want to rephrase, Shnatani, speaker to Shazeredi. I need not that kidney or showing on them. Don't also showing on Shazeredi. You can just kiddy out on the Banahal now, not sure. Exempt to non-exempt. He exempt from many people with higher pay aid or non-tax, essential workers aid, or they work, but they don't credit how much are they put in daily. Non-exempt, I think with a lower rate, you have to want the actual work daily at the office. It is in Sunday, I want to have the untitled, so they call
Honorable Yellow Hair. What? So what's your?
But my point of order is ask for this when the money comes back for reimbursement, this money for general funds will go credit either controllers or whoever working so they're going to credit their account with a general fund was going to be on one lump sum. When it comes to this money will be in one lump sum to the Navajo Nation credit. And then I know we had to do reprogram the money, and we're going to credit the general fund account for 2020. But not just kidding. Auto to 638.
Okay.
That account will go to 638 too. It's going to be on credit their account. That's the one I was questioning. Kurt. That's
Okay.
what I hope she understands. Thank you. All right, speaker.
Okay.
Thank you, sir.
All right. That colleagues, there's nobody else in the queue. Let me go back to Madam Controller to clarify that question that Honorable Yellow Hair was wanting to be clarified in further detail. Madam Controller.
Auto speaker, Ade, a clarification, Deneniki. There's a couple of things, as I understand, Nathan's, exempt, though non-exempt, special duty pay, we base it on what we call actual hours worked. So I think what you're asking is, on le office kude, on dodge nishto, edo dai hawanda sa on dodge nishtene, edigi that is the so to that answer, whether you're non-exempt or exempt, if the special duty pay, if you're eligible for it, and as I mentioned earlier, it either one of them, whether you're exempt or non-exempt, if as long as you meet the requirements of essential employees, then you're eligible for the special duty pay. Auto actual hours worked, you can be at work in the workplace. Ado died if an employee has a working remote situation worked out with their management and administration, then that counts as actual hours worked. Obviously, during these times, there are situations like our office here at the controller's office. We have the capability of allowing some of our staff to work remotely. So long as they're working remotely, that's between the employees and their supervisors and so forth, then all of that gets reflected on the timesheet. So, what we base the special duty pay on. So I hope that clarifies. Is that the only question? I believe I answered the exempt and non-exempt, although the actual hours work. So I think I clarified those two. So,
Speaker, I'm not satisfied with her answer. Yeah, I
Okay.
understand.
Okay.
I still have, let me rephrase this again.
No, Honorable Yellow here, you have no more time.
There's that something. There's that time.
Hey, with that, colleagues, let me go ahead and move on down. As of right now, I do not have anybody else in the queue. I'm going back to reserve time. Honorable Vince James, 56 seconds.
Speaker, do I have a reserve time? This is Delegate McGay.
Nope, you used it all. Honorable McGay. Honorable Vince James, once, twice. Moving on. With that, moving on down. Honorable Nathaniel Brown, 33 seconds.
Speaker, this is Delegate Brown. Can you hear me?
Yes.
Really quickly, my question to Madam Controller was to the housing. I needed her help. I need her help, and then how to make the amendment. And since she did state that COVID funding is directly related to helping out our people, and I think this definitely falls in that category. The other thing is I wanted to ask, Kayenta Township also gave a lot of money in this COVID to relief funds to our Kayenta, and actually not just Kayenta, but the 3 surrounding chapters and the 7 other surrounding chapters, giving them aid. And I will request for to give them back some of the funding. And then, Speaker, I also sent you an email from Kayenta Township on their request. So I'll resend it again to your staff, to Lashana, and to Hope, and to your staff also. So thank you so much, Ikehad. Thank you for this report. Everyone, thank you.
Thank you, Honorable Brown. That we go on down. Honorable Herman Daniels, 1 minute, 24 seconds.
Thank you, Speaker. I'm going to yield my time over to Delegate Yellow here. I see a national council after the pandemic. When a year ago, let's see me. So, my remaining time to have a speaker. So the cheat.
With that, Honorable Yellow Hair, you good? 1 minute, 11 seconds.
Yeah, lots of Celeste, brother. God bless my friend. Hold on, addition. Anyway, as I said, and as I want to rephrase my point on this one here. Did related sense of Azukandal, Shiki, Aro, Nal, Nisho, a based on the top, Panan, and they Washington, the actual work based on the timesheet. Did double paid at 80, what end reimbursed in the Ahonal Inc. and Tashin to Navajo Nation. Kwege aro kutlago yakuja. Let's say controller $2 million stand in the reimbursed. 80 is going to be general fund. That's going to be on one pot and all in one bowl between the three branches and the snip account. Another kid hopefully the answer this question. Here, another kid there. I want to speaker here though. Thank you very much. Hope you understand me. Thank you.
Thank you. With that, Honorable Daniels. Let me go ahead and move on down. We have a new player, Honorable Charlene Stowe. Honorable
Speaker,
Charlene.
Delegate James here.
Honorable Charlene Stowe.
Can anybody hear me?
Honorable Charlene Stowe. Okay, let me go back to Madam Controller.
Speaker, can you hear me?
I can. Honorable Charlene, Madam Controller, I'll come back to you. Honorable James, I'll come back to you after the Controller.
Okay, thank you. Sorry, Shada.
Other speaker, other members of the Navajo Nation Council, other kudo shistayo and would less even idin kidangi. So I believe what you're asking for is if we reimburse ourselves using CARES Act money, ado elahit au adat isati reimbursement to gi adrago klachigo in a different account, as opposed to if you reimburse yourself, the accounting treatment is to have it go to the original budget amount or the business unit. So so essentially we can put it back to the original business unit. That's the normal process, or similar to what we're doing with the FEMA reimbursements. We can set up a separate business unit account as long as we get the approval to do that. Let's say when we reimburse ourselves with all those expenditures that we already incurred, we keep track of it. As long as we set up the expenditure plan and so forth in that manner. So we can keep track of those dollars. We can do that specifically for the general fund. On the 638 funds, it goes back to the particular program. So general fund tikite ya e asati sajikod nahas neloshin elia e abe. So I hope that makes sense to you. I believe another Delegate Brown talked about housing. I believe, and I can look into it some more regarding housing. If there's housing needs, probably just need to meet the criteria and the requirements of the Treasury guidance and so forth. Auto Kayenta Township, if they've already expended their, they have expenditures related to COVID-19 and it's otherwise allowable. The only thing I believe we would need to do is treat them as a subrecipient. So anything on the Single Audit Act, I believe, will still apply to them as well. So if it's over 750,000, so those are the only things we can look into in more detail. I believe that's all I have for now. Speaker, yeah.
Okay, with that, we go back to the board. Honorable Vince James, 56 seconds.
Thank you. In regards to my last question, which was number 7.
Honorable James, it seems like you're
Hello?
sitting. Honorable James, can you hear me?
Am I unmuted now?
No, I could
Hello?
hear you, but it sounded like you were talking from outside the house and you were trying to.
No.
You were talking way far away from the phone. It was very faint. Now I can hear you.
Oh, okay. Thank you. Yad Ishak Kahasi, Sodosh Nandadan, speaker. So, Shande, in regards to my question number 7, essential workers, and also pertaining to the legislation that Honorable Carl Slater made the amendments to pay out $1,500. So the way I understand it is that we can go that route to make things easier for all our essential workers to get paid right away, where they don't have to follow nonsense and lengthy process of trying to pay our public safety or essential workers that have been out there since the pandemic started here on the nation. How well do you agree with that? Thank you.
Okay, with that, we'll move on down. We'll go back and ask Honorable Charlene So. Went once, went twice. Charlene So. Go back to you, Madam Controller, to answer Honorable Vince James' question.
Okay, speaker, Delegate Vince James, regarding question number 7. There are two things that we're talking about. We're talking about special duty pay that is essentially a hazard pay for the Navajo Nation essential employees. The program has, the policy is in place, and in essence, so the nonsense and the lengthy process by Pigi, that is essentially hazard pay. Auto Sagi financial assistance. That is a financial assistance that could be open for a targeted group, for instance, your small businesses, or it could be for other purposes like your utility assistance or home rental, mortgage type assistance, or just a general financial assistance. Those are all programs that if you read the Treasury guidance, so those are things that a government like us can do. So those are all open. Like we can determine what the eligibility criteria are for that and whether they apply or not to our Navajo Nation employees. That is a much broader financial assistance program that is based on a needs or a means test or an eligibility criteria. So we're talking about apples and oranges. The other thing is for hazard pay, special duty pay. Those are all just for the Navajo Nation employees, whether they are exempt or non-exempt, but they are essential. The reason why it is, I guess, would be a lengthy process is because, as I mentioned earlier, you have to have the budget. Every program department, they have to have a budget. I can't cut a check unless there's a budget in place. So some of those programs, they've had to shuffle their budgets. So that can add to the fact that some of the employees they currently are unable to get paid because their programs don't have the budget. So so the other piece of it is because we implemented this special duty pay around May, the beginning of May, the special duty pay can retroactively be paid all the way to March, the beginning of March. So a lot of the requests that we're getting in are based on what we call the actual hours worked. So we have to have a measuring stick. I call it a measuring stick in order to base the special duty pay on. So we just say, okay, we're going to pay you this amount. We actually have to say the person has to put in the actual hours work. So therefore, some of those are not correct. So we have to send them back and say, go reconcile with your timesheet. And so that takes time. So I think last time I mentioned about 3 and 4 documents that we get, we have to send back. So we don't make a payment unless those documents are correct. And so those are some of the hangups in the process itself. So our office relies on the departments and the programs to make sure that not only do they have a budget, but also that the documents that come to our office are correct. So that's not, if a program is run right, then you have your managers that track their budget and they do the paperwork on time and correctly, then it's not a problem for us to pay it. And also, I don't know if you were here earlier, but we have to process these special duty pay through our payroll system. We cannot do it through our accounts payable system because we're talking about payroll. These are subject to employment taxes. We don't mess around with the IRS. So therefore, we have to run them through the biweekly payroll system. So I think that's, so I think your question was whether I agree. I think we're talking about apples and oranges. So there's no, if a person gets a special duty pay, as long as they meet the eligibility of a financial assistance, then, you know, they meet the eligibility. So I believe we are talking about 2 different programs. And so whether they get one or both, I mean, it's up to the criteria. So I just want to emphasize that as well. So I hope that answers your question. Yeah.
Thank you, Madam Controller. With that, I don't have anybody else, and is there time? Let me go back to see Honorable Charlene. So, once, going twice, or 3 times. Jill, say anybody? Nobody's texted in, nobody's said anything, so that, colleagues, go on accepting the controller's report. Going once.
Speaker.
Going
Speaker,
twice.
Speaker, my question wasn't answered, Eugene, so.
Honorable Eugene, so your question was answered. Go. Rephrase your question.
A simple question. I asked, if, since controller knows the money, the act, CARES Act, I asked her if we would have this sent directed to the president and her and the division director and the their council to expedite these funds according to the CARES Act, would have been faster? That's what I asked her. Thank you.
Okay, Madam Controller, let me go back to you.
Auto, yeah, Speaker, Auto, Delegate Eugene So, and, okay, Tiaj, whether your question of whether if leadership gave it to the president and myself and I believe division directors, and she can just come up with it, whether that's faster or was faster. I think I feel a little bit left on the spot, but I'll answer the best way I can. I think hindsight is always 20/20. So whether we had could have done things a little bit different up to this point, you know, there's always hindsight 20/20. But having said that, mind that these dollars, Treasury was still clarifying things as we're moving along. So I only got the benefit of a lot of my understanding of this by talking to my peers in the industry as well. So, but I think at the end of the day, there still needs to be involvement collectively. Obviously, leadership has are the policymakers. So, I mean, you know, I can sit here and say something could be faster, but I only have the benefit of looking back, because at the time, keep in mind at the time when we started with this, some of these clarification and guidance were still being defined and so forth. So up until this point, even the other week, we finally got more clarifications from the Treasury guidance and so forth. So because the federal government keeps defining these things. So they left the law as broad, but then they have certain guidance as well. So I don't know if it would have been faster. I think we can say it could have been faster, maybe. I'm not sure, but if you're asking me for a yes or no question, I mean, we took as long as we have. I feel like we're not out of it. I see we have 5 months, so I have faith in us, in leadership, in the Hito Ado Ashko, Ashkishna Anisho Shimbini Natushin Ahaeta di Nisto, the Nebicato, Washiki Atin of Base of Bichin, Hota di Nis, Ede Yakut Esso. I don't know if that's satisfactory, but that's what my input is right now at this point. Ado Shahab.
Thank you, Madam Controller. Hi, colleagues, I don't see anybody else on the board, no one else with reserved time. So let me go ahead and call for the question on the receiving report from the Navajo Nation Controller's Office. Sivella, let's go accept the roll call vote.
Begay? Honorable Elmer Begay?
Vote green.
Honorable Elmer Begay votes green. Honorable Key Allen Begay Jr.
Office call. Somebody. Delegate Key Allen votes green.
Honorable Key Allen Begay Jr. votes green. Honorable Paul Begay Jr.
Paul Begay votes green.
Honorable Paul Begay Jr. votes green. Honorable Nathaniel Brown.
Delegate Brown votes green.
Honorable Nathaniel Brown votes green. Honorable Eugenia Charles Newton.
Charles Newton votes green.
Honorable Eugenia Charles Newton votes green. Honorable Amber Knusbach Crotty.
Delegate Amber Canis-Valcrotti votes green. Thank you for the report.
Honorable Amber Knusbach Crotty votes green. Honorable Herman Daniels Jr.
I vote green.
Honorable Herman Daniels Jr. votes green. Honorable Mark Freeland.
Green, thank you.
Honorable Mark Freeland votes green.
I saw that one.
Honorable
I saw that one. So there's another one. Take it out, Commissioner.
Honorable Pernell Halona.
Colleagues, please mute your phones.
Halona votes green.
Honorable Pernell Halona votes green. Honorable Jamie Henyo.
And you votes green.
Honorable Jamie Henyo votes green. Honorable Vince James.
Delegate James votes red.
Honorable Vince James votes red. Honorable Ricky Nez.
Nez votes green.
Honorable Ricky Nez votes green. Honorable Carl Slater.
Delegate green.
Honorable Carl Slater votes green. Honorable Raymond Smith Jr.
Red.
Honorable Raymond Smith Jr. votes red. Honorable Wilson Stewart Jr.
Green.
Honorable Wilson Stewart Jr. votes green. Honorable Otto So.
Nay. Green.
Honorable Otto So votes green. Honorable Charlene So.
I vote green.
Honorable Charlene So votes green. Honorable Daniel So. Honorable Daniel So
votes green.
Honorable
I
Daniel
vote
So
green.
votes green. Honorable Eugene So.
Oh, thank you.
Honorable Eugene So votes green. Honorable Thomas Walker Jr.
Thomas Walker votes green.
Honorable Thomas Walker Jr. votes green. Honorable Edison Winika.
Green.
Honorable Edison Winika votes green. Honorable Edmund Yazzie.
Green.
Honorable Edmund Yazzie votes green. Honorable Jimmy Yellowhair.
Honorable Jimmy Yellowhair votes green.
Honorable Jimmy Yellowhair votes green. With that, Mr. Speaker, you have a vote of 21 in favor and 2 opposed. Mr. Speaker.
Yeah, 21 in favor, 2 opposed. Speaker not voting, motion carries. Thank you, Madam Controller, for being here with us this morning and this afternoon. That, colleagues, moving on down
Speaker,
to item number 9. Honorable Eugene So?
just for the record, I was trying to, during the roll call, trying to answer all files, so just to let you know, for the record.
We got you, Honorable Eugene So. We got your vote. You voted green.
No, during the roll calls, when we started back up. Thank you.
Okay. That, moving on down. Item number 9, oral reports. Item number A, report from Indian Health Services, IHS. We have members from IHS on the line.
Hi, good afternoon. This is Rosalind. Can you hear me?
Yes. Hello,
Thank
Michelle,
you.
how are you?
Good afternoon, Speaker. I hope you are doing
Good
well.
afternoon.
Good afternoon, everyone. Again, honorable delegates and of course, Speaker Damon. Let me first start. I'll have just a very brief report and I want to spend more time on questions if you have any. Let me first start by thanking the members of the 24th Navajo Nation Council for your work and commitment to improving the lives of our Navajo people. With that, I will say next month will be my 1 year that I've been in the Navajo area. So we have been doing a lot of work that we can talk about that in this past year. But I also want to take a moment here just to thank the Navajo area IHS staff that have worked tirelessly over the past 5 months, particularly with this and during the pandemic. So we continue to work hard and we continue to demonstrate our ability to serve the people on the Navajo reservation. To that, while I did already submit a written report, I will just cover a few things that I wanted to note again. One is that, we've learned a lot during this time, particularly over the past 5 months that we have been in this pandemic on the Navajo reservation, as well as all of the surrounding areas. And we continue to use the data that we have gathered to really look forward and try to figure out how we're going to prepare and where we might need to adjust for the fall when we're going to deal with the flu, as well as what COVID-19 will bring to us at that point. So at this point, we are looking at all of our processes. We're looking at our policies and procedures to make sure that we have done what we need to do, and also give ourselves a chance to make any changes and pivot at this point. Our goal is, of course, to reopen and reintroduce services to the Navajo people, to the people that we serve on the Navajo reservation, but we have to do it in a safe manner. So we're working through all of those protocols right now. In addition to that, one of the key things, or several key things that I have learned during this process is really the staff that we have at our area office level. We were clearly, while I think we acted as well as we could have, we were certainly not prepared for what we had to deal with. And I really have to commend the staff that have really stepped up to do the work that needed to get done. And we will continue to do that. But with that was really looking at and assessing the work that we did and assessing our staffing levels and so forth. And one of the things that I've already started to make adjustments on is really looking at the staff in our tribal operations program. So we have brought on 2 new staff members already, bringing on another staff member, and this really is to help strengthen our relationship with the Navajo Nation. With as big as the nation is, we need more people that are going to be on the front lines with the Navajo Nation tribal leadership to make sure that we are covering all the bases that we need to as we continue to improve our business processes. So we will continue to do that. One of those objectives is really to work very, very much hand in hand and closely with this body to make sure that information is flowing and continues to flow. We have done also a tremendous amount of coordination with the Speaker's office in terms of participating on weekly agency calls, as well as more recently we have had several calls with chapters to inform people of where their projects, water projects are, and any other issues that they may have moving forward. So we continue to do that. We will continue to do that. Our staff is ready now in more positions. One of the things that I also recognize during this time is the need to share information. We need to have a place where our information is more public and that you're able to access me and my staff at any given point for anything that we can help you with to be able to strengthen your knowledge as well as being able to be informed to make the best decisions possible. Well, we are appreciating, as the numbers are coming down, COVID-19, we are also relooking at our infrastructure and our governance. As part of any healthcare system, we have compliance requirements that we need to comply with throughout the year. And so COVID or not, we have to make sure that we are following all of our policies, all of our procedures. Just for example, we brought on more than 300 volunteers during this time, and any provider, any healthcare provider, physician, PA, nurse practitioner, anyone that we bring on, we need to make sure that they are properly vetted and credentialed. And we did exercise an expedited emergency process during that time. So last week we were in governance meetings with each of our hospitals to make sure that we reviewed all of our documents and made sure we verified that all the background checks for all of our providers were as they said they were at the time that we were clearing them. So it is an important process, again, to make sure that we bring in the best and those individuals that are able to see our patients as we go through this process and continue to move forward. We continue to use a number of volunteers that have been very helpful to help us get through this these last difficult months that we have. But it's also an opportunity to really look at our quality program, again, with a very sort of skilled staff that we have in the area office. Quality sometimes gets put to sort of a second level or even maybe a third level. And to me, that's unacceptable. So we're looking at how we make sure we stand up our quality program and make sure that, again, we are prepared for any visit that at any time throughout the year, any hospital, any health facility can get a visit from CMS or Joint Commission and so forth. And we're anticipating that those visits will come forward. We're also trying to make sure that we're evaluating the safety of our employees. I have heard in many of the conversations with the delegates that there is concern about the lack of PPE, the lack of appropriate PPE, the communication that we have with our staff. So we're working to make sure that we stay in front of that at all times and trying to educate and re-educate our staff to ensure that we have proper PPE as well as sufficient PPE. So part of the risk analysis and part of our check right now is to make sure that all of these protocols are in place and that they are working. As part of the governance meetings last week too, we reviewed all of the reopening plans. We know that many of our patients continue to need medical care outside of COVID and that we have to go back to some kind of a process. But to do that means to reevaluate all of our processes in terms of just the building setup, how we're going to reintroduce patients into a healthcare center. So some of our facilities are doing this in a very slow and cautious but safe manner. So we're hoping that you can see those. I'm also intending to provide to you each of the delegates for the federal operated facilities. I give you the executive summary of where we are in that process so you are aware and have input on those. We also, as you can imagine, have collected a tremendous amount of data during this time. And one of the things that IHS does very well is collect data. So we're looking forward to an opportunity to review that data. And the reason that that is important, that's also preparing ourselves for the fall and what we can anticipate for a perhaps another wave of COVID, as well as the flu. During this time, we also set up a patient mobilization plan. What this does is it allows us to process patients either at the local level or into any of the isolation units where a person might need a place to isolate. We also did a tremendous amount of case management. As you can see, our numbers are well into the 8,000s. So all of those needed to be tracked and evaluated and coordinated as we work through making sure that we continue to bring down the numbers of COVID-19 positive cases. Additionally, we have a very robust test plan and schedule. We will continue to do that. Right now, what I've asked our team to do is go to the community level, because we know that many of our patients may not be able to, for whatever reason, come to our facilities, and we want them to get tested if that's what they need to do. So we will continue to do that and update our schedule, and we will share that with this body as well. We've also worked tremendously with many state and federal partners, as well as the Navajo Nation. We have executive participation on the Navajo Nation Command Center on a daily basis. We also worked hand in hand with FEMA, CDC, our IHS headquarters, and HHS, working through and coordinating communication and services throughout this 5 months. We also worked very closely with the New Mexico Governor's Office. That was absolutely one of the pleasant experiences through this whole part, is just the services and the support that we got from the Governor's Office, from the New Mexico Department of Health. As a result of that, we were able to build an interface to share data between the Navajo area IHS and the New Mexico Department of Health, so we can again have data in real time that's being reported throughout the state of New Mexico, as well as Indian Health Service. So that's allowing us to do that. They also continue to support us through staff and hotel space to have the isolation units in the Gallup area, as well as in the Shiprock area. So they, again, have been a great partner and been able to work with them throughout this entire process, as well as they continue to provide support to us. We've also had the same kind of relationship with the Arizona Department of Health, again, trying to strengthen and making sure that we're covering every area that we can, whether this has to do with tracing, testing, supplies, and so forth. With regards to our reopening plan, again, as I shared earlier, this needs to be approved by the governing board, and so we have gone through this process last week. There will be soft openings, there will be safe openings in terms of us having to reopen. So some of the things we are looking at is that many of our buildings are old buildings, and so even the waiting rooms, we're going to have to try to figure out how we're going to be able to separate people in waiting rooms. And so we're working through those steps right now to make sure that we continue to encourage and have more space, do the social distancing, as well as how we're going to what we're going to require of our patients coming back. Certainly wearing masks and those kinds of things that we will need to do. As I said, and I was getting to my closing remarks, compliance is really important. We have to make sure that, we are meeting all the requirements for certifications that we have, and we will continue to review our processes. And so this, right now, what we're enjoying this sort of slow, not as crazy time as we were, just a month ago. We're able to sit back and evaluate our processes, and this is what we're doing now to really look at how will we move forward, what will we do, and how do we prepare for the fall. I think that's where our focus is right now, as well as we've had many of our staff that have been impacted by COVID-19, as we have many of our people. We've had many staff that have tested positive for COVID just because of the work that they are doing, our frontline workers. And so we've been working with them to make sure that they have the resources that they need to get well as well as mental health resources that they need to be able to move forward. So we have been working to secure an additional 8 mental health providers that requested went in. We continue to have a fair amount of opportunities for our staff to work through the issues that they have experienced. And we have to continue to do that because, of course, we can't do the work that we do without our staff. So, Mr. Speaker, that is my report at this point, and I'm open to take questions. Thank you.
Thank you. So, that, colleagues, is there a motion?
Is Delegate Brown on motion?
Brown. Second by Honorable Halona. That, colleagues, any comments, questions? I don't have everybody in the queue.
Delegate Brown, I have a question.
Going twice. Honorable Brown.
This is Delegate Brown. Ayata Speaker, thank you, Ms. So, for your report. And above all else, I really want to thank everyone at Navajo Area Office and the IHS across Navajo. Thank you for everything that you're doing. Really
Hold
quickly,
on, Honorable Brown. Colleagues, can you please mute your phones? Go ahead, Honorable Brown.
Thank you, Speaker. My first question is, I'm actually, I try to visit with the local Kayenta IHS or call them on a regular basis. And I live and I know a lot of the employees. I grew up with them. So when I hear something disturbing, I always ask them to bring it to my attention. And so they've been doing that. So one of the other things is you just mentioned that your employees get tested. What I'm hearing from a lot of our Navajo relatives that work at the IHSs are they have to take leave in order to take a test. And then I know of a supervisor that came to IHS that specifically said you cannot get tested during your lunchtime also. I mean, they get exposed on a regular basis. And the other thing is this individual, and I'll give you the name of the supervisor as well. She said, even if my employees test positive, you are still required to come to work. Is this a lawsuit that's waiting to happen? And I need something to happen to this because I'm getting people calling me stressed out. They need this job. And so that would be my first, those are my comments, and I'll reserve the rest of my time. Thank you.
Reserve your time at 3 minutes and 23 seconds. Any other comments, questions, colleagues? Chairman Daniel So.
Thank you, Speaker. The colleagues of the council, and thank you for the report. That was a fast-moving report. I hope I didn't miss part of it. And this question, the alternative care sites. I know in the first few months you were funding Wildcat Den ACS, and then the Shiprock Alternative School gymnasium and dormitory. And we've been receiving conflicting information. Yesterday, President Nez said only the SASE was being vacated. However, we've also received written reports that the Wildcat Den was also being vacated. And so I guess the main question is, how much was it costing the Navajo Indian healthcare system to basically fund those two sites? The other is there was a press release by the President, about the, I think it was the watering points, 52 places. Was that matching funds with the IHS, or was it totally Navajo area IHS funding? The reason that I basically sought a bulk watering station for Sand Springs was there was none listed for Whitehorse Lake, and those folks really are hurting for water. There's a group called Water Warriors that have been out there sometimes making 4 1,000-gallon loads a day, and the chapter has been paying for their help. So that's one of the reasons I sought extra monies through the CARES Act to be able to fund that bulk watering station. And again, thank you for your rapid moving report. And that's just, I guess, the character that you've imposed, not imposed, but the whole Navajo area healthcare system is really changing with the type of leadership that you've come to Navajo with, and we really, really appreciate that. Thank you. That would be the extent of my statement and questions, Speaker.
Okay, thank you, Chairman. So, that I don't have any more comments. Anybody? Oh, let me go back to you, Ms. So, for I guess a response on Honorable Nathaniel Brown's question.
Thank you, Speaker Damon and Delegate Brown. Yes, so with respect to the Kansas Service Unit, I am well aware of the concerns that have been raised there, and I was actually on site to meet with some of the community members, I think about a week ago, to really work through and talk through some of the similar concerns that you have. I've also sat down with their leadership, with the service unit leadership, to ensure that they hear directly what I'm hearing about the concerns that are on the ground right now. One of the good things that we're in right now, I guess you can say the thing, is that we do have the testing supplies. IHS has done a great job in securing testing supplies, so that shouldn't be an issue. With respect to how time is being accounted for, I can follow up on that. Certainly, that we certainly encouraging testing. We're at, I think, every facility we're doing more drive testing or more testing that we want to make sure that we make available to not just the community people, but our staff as well. So I will follow up on that. And when I was on the ground about a week ago, we did have a very good meeting with some individuals that were able to present in person or by phone. So I'm hoping that I can share those with you and I can maybe talk offline with you regarding names of the individuals. Well, I did for names, got some names and those that were addressed as a week ago. With regards to Daniel, so thank you for your question. With regards to alternative care sites, so both of them, I understand that right now are what we're calling in a warm status. And I just was notified by the school for the Shiprock alternative care site that to go back to the original position as of August 1st, which doesn't leave us a whole lot in here between, and is part of the use agreement that we signed with the BIA for this facility. So we're working to coordinate how that's going to happen and to meet that deadline. With regards to cost, so how that generally works is that the Navajo Nation signs an agreement with, in this case, the Army Corps of Engineers to build out the ACSs. And what those final dollar figures were, I don't know, but one was 40 bed and the other one was 50 bed facility. And so they pay for what we call the wraparound service as part of the agreement. They, meaning FEMA, pay for the wrap, and that's like the food, the security. Well, I guess it wasn't security. It was the food, it was the cleaning of that facility and so forth. That was in the original contract. We didn't have that report. Excuse me, we don't know what. Have been working with the Unified Command Group to try to set up another contract that would include the cost as well. And that is not being run through the Navajo Area IHS. So my understanding is that's being coordinated by the Navajo, through the Navajo Nation process. So I'm not sure what even those dollar amounts were. However, we did draft up the scope of work for them, including the staff. So when we were operating the ACSs, the alternative care sites, we did have staff that were there 24/7. We also had some volunteers there. So we'd have to determine our costs, we'd have to look at who was there throughout that process. But that was part of our contribution. However, for the isolation units, which are the hotels like at Chinle or even in Gallup, our staff continue to provide support there. And at the Chinle site, has able to build out the wraparound. IHS did stand security because there was issues there with non-compliance kinds of issues. So we did activate a security contract as well as a linen contract because we weren't able to get those through the hotel or the current agreements that were in place. So I can give you those numbers of what we have negotiated separately. With regards to the water, Chairman, I just sent you some information. I'm glad to share it as well. There's some very good information coming out of the water access group, and it talks about all the different watering points. With respect to the funding, IHS did put up the first $620,000 to do an evaluation of all of the 110 chapter watering points. That was the purpose of that. The report I just shared with you that shared on the water calls. There's for those locations, because what we have seen is that those places and those homes and those individuals that don't have access to water are probably the ones, they are more vulnerable to COVID. And so that was how the priority was supposed to be set up to at least do that first step of doing the chapter watering points. But there's additional information that's in the report that I'm glad to share as well. So that's what I have. I don't see the facility or the chapter that you identified on the list. I tried to look through it very quickly, but that's what I have. Thank you, Chairman. So.
Okay. I don't have anybody else on the board, nobody else in the queue, going once.
Eugene So, Speaker.
Going back to Honorable Brown.
Eugene So.
Speaker, Thomas Walker.
Honorable Brown, 3 minutes and 27 seconds. Going once, going twice, going 3 times. Going on back to the floor. Honorable Eugene So, go ahead.
I got 2 questions in regards to the Chinle Community Center. Are they going to reopen it or are they going to keep it? Because I'm trying to look for my voting place. I've got 2 precincts that during the vote, the primaries coming up. Another one is I got tested. I think it's 3 months ago now, and I'm still waiting for my results. So I'm still in self quarantine for 90 days now. When are they going to ship me my results? So that's what I'm waiting for too. So I've been in quarantine for 3 months and people don't come to see me. They just leave food outside for me and I'm still sitting in here. And I got no symptoms. I'm not sick or anything like that. So I had to still be in self-quarantine. Thank you.
Yeah. Thank you, Honorable Eugene. So, moving on down, Vice Chair Walker.
Thank you, Speaker, members of the council, and our legislative staff that are assisting us with this summer session. And then the report from the IHS, Ms. Rosin. So, quarterly report. I guess I'm requesting a written report also coming from your office. That would be really helpful because I agree with my brother Daniel. So this is a fast-moving report. I'd like to see the written version of the report because we have constituents to give the information to as they await our reports all the time, especially during this emergency. There are questions always say, what's the BIA saying? What are they doing? What's the IHS doing for these for the emergency? So we have to provide that information. Although my question this afternoon, as I think about vaccines and treatment drugs again for COVID-19, what is our trustee, the Navajo Area Indian Health Services plan for vaccines and treatment drugs, having that, making that accessible to our Navajo people? Thinking up ahead, I hope that's not too far in the distant future, that becomes a reality, more and more effective treatment drugs and effective vaccines. What would the Navajo people, how could we access that for our people? And the concern is always like with populations in underserved, underrepresented, underprivileged areas or fitting in those categories. Those populations are certainly vulnerable and they're at a disadvantage and there's plenty of disparities. Given that, I would not want to see our people being left out or being at the back of the line, so to speak. So I feel that our trustee, as well as our own Navajo Nation government, have the ultimate responsibility to ensure that we get the best health care, available health care and medication and treatment available. I know it's work in progress. We're all doing our best. I understand that. And I thank the IHS for their continued services to the people, especially during this these difficult times. And I would say to my constituents that the Navajo healthcare systems, it is what it is, but it is the best available to us. It's out here. It's a given. It's for us, and we'll always have it. I don't know what we do without these healthcare resources, healthcare service delivery. I don't know what we do without it. A scary thought. But nonetheless, also, we must advocate to our trustee that we continue to seek the best health care possible. I'll go back to the vaccines and treatment drugs. I know maybe too early to mention name by name what's being offered or what's in trial stages because they're not available yet. They're not made available yet. these vaccines and these treatment drugs. But nonetheless, when they do become reality, they become accessible. You heard from me that I would advocate as strong as possible, as clear as possible, that our people, get served first. Ideya, Speaker, Ali, Ado, Director. So, yeah.
Thank you, Vice Chair Walker. Moving on down. Nobody? Let's see. This thing's down. Is it in the queue? Okay, Madam Chair, Charles Loon.
Yeah, Speaker. Thank you, Ms. Stowe, for your presentation. I appreciate all the information, but as my dad stated earlier, it would be great to get this information in writing. What I would like to know specifically is where IHS stands on the traditional services that are being provided to our people by our traditional practitioners, the medicine men, and then the roadmen through Navajo, and then also, the herbalists who have been providing herbs for Navajo people. Those services that does provide traditional service in regards to prayers. But I wonder where IHS stands on this matter. And I ask this question because a lot of traditional people go and they take part in traditional sweat ceremonies. As you know, these sweat ceremonies, they do have, the heat is very, very, the ceremonies obviously are very hot because it's a sweat ceremony, but it also cleans out the respiratory tract, and it also helps with the healing part, the spiritual part of healing for an individual. So I'm a little bit curious as to where IHS stands with these traditional ceremonies. And then two, I'm also wondering about the contract health and the payments for the COVID-19 survivors and to various the application, and how that's going, whether that's going to be affected, and if so, what are we looking at as far as individuals who have recovered from COVID-19 and their house bills? How are those bills going to be paid? And is that something that IHS is currently looking at and receiving more funding for? So with that, Speaker, those are my two questions. I reserve the rest of my time. I'm going back on mute.
Hey, reserve your time, Madam Chair. Charles Loon at 2:52. That. Let me go back to Ms. So. Charles and So, go ahead.
Thank you, Speaker. To Delegate Eugene, so thank you for your questions. With respect to the Chinle Community Center, or I think the Wildcat Den or the Community Center, that facility is actually being coordinated or administered by the Navajo Nation. Unlike the facility at Shiprock, IHS did not have to sign an agreement with BIA on that facility. So it is my understanding that that building continues to be used for the alternative care for isolation. I heard informed of any deadline like I have on the Shiprock facility. So as it is right now, my understanding is the community center will continue to be used for the isolation. What status means that it's being used right now, and we can build that around services, because we have to have feed people, care for the, have the staff to support services that were provided out there. There was a limit, though, that for a tier 2 or a alternative site that it's isolation only needed for those individuals that need isolation. With respect to your test, sir, I apologize that you have not. I think I'm not a doctor, but I think 90 days is sufficient for self-quarantining. I will follow up with in it and have some on to you getting your test. So I sincerely apologize for that. With respect to Delegate Walker, thank you for your questions and understand and hearing from it what all the different conversations regarding vaccine or treatments of for COVID-19. Now, just is using remdesivir to address some of the patients. We found that to be working. Some of the patients, so we continue to have supply of the that are shipped to every facility on every hospital on a regular basis. With respect to overall vaccine, you can anticipate that this is going to take a while. I advise Navajo to be the front line of that and to be the ones to be tested on. Rather, we see how progress goes, how the process goes, and some place before we jump into the thing. But we are looking at the different ways that we can treat the patients at this point now. So severe is what we will continue to do that. With regards to the report, I apologize. I did send that report, so I'm sorry that you have that report. It's a 16-page report that was provided for the weekend. So that should be coming to you here shortly. With to Delegate Charlton, with traditional services, absolutely support. Navajo area please supports the efforts of traditional hearing program. That we want to ensure this is one of those areas probably have to reconsider what is the best approach that we move forward in. I don't think that just say, okay, we're back up to what we were doing before. How clearly that process. I do have staff working with the tradition to find a way. How can we go back and go to practicing the way we have in the past? But too many of our, when you read my report, that many of the facilities do start with a morning person. We are utilizing additional to get our day or help us through these difficult processes and we have. And so we will continue to ensure that and communicate because that's really not my area of expertise. For some guidance with regards to that. With regards to patient care or CHS, whatever you might know that from, please, as and I have more updated information. This is something that I'm monitoring very closely is the utilization of PRC. So back to the 23rd, again, this was very, very, we had referred out, this is only on the IHS side, we had referred out 1,400 patients. And no since then, we had $10 million in PRC funds that were given to us for COVID. I will provide that report separately. And all funds have been allocated. So anyone that has come to our facility, we had to refer them for care. That information is available to me. And the reason it's available, I'm tracking, is because we have access to chef-sponsored catastrophic PRC that are available to maintain in orders. I directed every facility to ensure that we have.
Speaker, point of order.
Madam Chair, point of order. What's your point of order?
Yes, Speaker, I apologize. I was trying to do a point of order at the very beginning. There's a tapping sound in the back, and Ms. So I'm getting every other word that she is saying, and so I tried to do a point of order, but it kept saying that I was being muted. So I'm not sure if others are hearing that tapping sound, or if others are hearing that interruption where they're only getting every other word that Ms. So is speaking. I'm going back on mute. Thank you. I apologize, Ms. So, for the interruption.
Thank you. I hope this is better. So as I was
What is
reporting
it?
on the PRC,
Go ahead, Ms. So.
as I was reporting on the PRC or the, I tracking that very closely. Those are funds that we can get reimbursed for. Anything $25,000.
Oh, it's not coming off of her.
Can you hear me?
I can hear you, Ms. So.
Thank you. So I tracked the PRC very closely. As of June 23rd, we did refer or move over 1,400 COVID patients out of the Navajo area. This is only IHS data. And we were allocated a little bit over $10 million for PRC. All of those funds have been obligated. But in part of our governance meeting last week, we did make sure that that all of the cases were being claimed so we can recover some of those monies to help us cover additional costs that might be coming forward. In addition to that, as I raised with a couple delegates, is that we have two airstrips, one in Shiprock and one in Chienta, where those are not working and we need to get those fixed. And this came up earlier at Crown Point, and we had incredible support from the tribal delegates and the working to coordinate to fix that. So those create a risk for us if we don't get those fixed. So I will continue to push that. That is related to, of course, the PRC cases that were needed to move out. Thank you, sir.
Thank you. We go back. I got two new individuals on the board. Honorable Elmer Begay, go ahead.
Oh, thank you. Speaker, can you hear me? Hello? No.
We can hear you.
Okay. Hakashin Ado Ms. Robinson, so Yate. There's two. One is a complaint, but you see, my mom about a month ago, she got sick, and we took her to. I took her to Winslow Indian Hospital, which is a 93638 hospital. For her others, she was treated kind of. That son is my mom is 80 years old. The next I should go. She can explain herself the way she is. There's some people they're there. Then the next I said but we found out that they can speak Navajo, but they, I guess, elderly than so. And I guess you could say that prefer Hajo la the next Spilikan the Cassitin Jahasti, but Edo so my mom explains really good to me in the next Eshigo. So that's one thing that I had a complaint, but see what happened. She was diagnosed with pneumonia because she has to stay overnight. She thought, so they took her from there to Winslow Memorial Hospital, which is Little Colorado Medical Center. So she was there in the morning. When I called her back over there, she was telling me that that's started while the course she had this kino to go. So I told her, so I call around and tell one of my sister, she's a nurse there, she got to that, I guess, infection control person. That they told us that that person was positive, that they put her in that same room. Then we had to make a complaint, calling over there from different places. Dog, so they took her back out. There was rooms available. So we were. The next day she was okay. Don't need it. That's when we said, "Hey, my mom, my dad, my dad had she's 85 years old, 88 years old. And had a respiratory problem. My mom was in contact with the health person. No, so we go by the procedures of self quarantine and isolation. So my mom's in the so we had to put her into a hogan. One night, this kind of we brought in my brother's traveling trailer. So we're fortunate that we have these available. So I get that these people they're not being they're not very going by the procedures, and then they can put her into a COVID person. So I wrote a complaint letter to Winslow Indian Healthcare Center, 638. So I don't send that, like they just say apologizing that, and then with Colorado Medical Center down, I don't know CEO send that. So I sent a letter to you now. I don't know, you haven't respond back to me for what we can do. I think we need to really, the way we've been treated as the Navajo people, especially with an elderly, that they were in contact with a positive COVID. So that's my second my complaint against individual. So Nana, I wrote a letter to same complaint regarding to Dr. Jill Jim. I don't command center. Somebody might question me at then. So this kind of complaint, who do we complain to 638? Who's overseeing that? It is my question. That's it.
Elmer Brigade, moving on down. Honorable Otto So.
Thank you very much, Speaker. One area, I guess, Roslyn, well, first of all, I did get your report emailed out, and I don't. It's almost a year that you're here. It's so good that you're here among back on Navajo, try to provide and guide, steer the ship of Indian Health Service on the Navajo area, and try to ensure the quality of health, the greater quality for the Navajo people. I don't say I don't. Well, just one thing. One area is we know that the flu season's coming up. The start up. With that, the flu season that's coming, is there a plan that Indian Health Service is gonna try to help or try to put out to have a flu vaccination drive across the Navajo Nation at all facilities? Alcohol, Banyanske, is it better? Do we need to get our Navajo people, ask our Navajo people to get their flu shots With that, reserve my time.
Reserve your time in 3 minutes and 8 seconds. Let me go back to you, Ms. So. So go ahead.
Thank you again, Speaker Damon. So going back to Mr. Begay, thank you for your questions. With respect to, I did see your emails. I did see the concern that you expressed. I guess this is sort of a point of clarification for me as the Navajo Area Director. It has been my experience that 638 programs, that they are governed by the Navajo Nation. And so, I'll see Dr. Jimmy tomorrow morning and I'll ask her if she has seen your concerns that came through with respect to that. You know, as we're dealing with COVID, and as I talked about a little bit earlier in reviewing all of our facilities right now, that's what I'm talking about. We cannot mix, and especially as Delegate So is talking about, as we're going to move into flu season here within the next couple months, we have to find a way where we sort of have people come in through different doors, if you will, so we're not mixing either flu or COVID patients or other patients that are coming in for something else. And so this is a very complicated process, and I don't know what the hospital did and where they missed that opportunity. This is something that we've been stressing to all of our hospitals, that we have to find a way to make sure that we don't mix patients. So I don't know how I can respond to you, Delegate Begay, and I'm really sorry that your mother went through this process, but it is very difficult and it's very complicated, but nonetheless, our Navajo people do deserve better and do deserve more. With respect to interpretation and our Navajo speaking people, I'm practicing myself, so I'm hoping to get better at that. But IHS is required to have interpreters. And so when you get to see my report, you'll talk about some of the places where we're making improvements there and certifying that we have sufficient Navajo speaking people to help communicate with our patients. So hopefully that helps, and I will try to circle back to Dr. Jim for you to see if she can frame a response for you on that concern that you raised. With respect to Delegate Otto, so you're right, in the flu season, we have to start preparing for that now and trying to find a way to make sure that we get our patients ready for that. So the sooner we start working on that, the better off we're going to be. And I'll go back and visit with my team on how quickly we can start getting some information out there with respect to flu drives, which is normally what IHS does anyway. So that's what we will expect of our teams to get out there for flu season. So thank you. Thank you.
Thank you, Ms. So. That, I'll have everybody else in the queue all lined up, and we'll go back to reserve time. Let me go on back to Honorable Nathaniel Brown, 3 minutes, 27 seconds. Honorable Brown?
Speaker, can you hear me?
Well, I can hear you now.
Okay, Speaker. I just wanted thank you, Ms. So, for your response. When you're coming back out here to Kayenta the next time, can you please invite me? Of course, using all the necessary precaution. I do appreciate you visiting Kayenta, so we will continue to advocate, and on behalf of other individuals who've been involved in this as well. So the only other comment I have is, has IHS started checking for? I think I had the same question. Actually, never mind. You did respond to that. So that's all my comment, and I will waive unless someone else might want my time, but I don't think anyone does. So thank you, Speaker. That'll be all. Yeah.
Thank you, Honorable Brown. Moving on down. Madam Chair, Charles Newton. 2 minutes,
Thank you,
52
Speaker.
seconds.
And thank you, Ms. Stowe, for answering my questions. Unfortunately, like I said, I there was a tapping sound when you were talking, and I got every other word. So if possible, could I get that response in writing? I don't know if other people were hearing that same tapping sound. Some delegates have texted me to say that they also heard the same as well. So I think that these questions are really important, and it would be great to get that information out to the people. So if you could share that information in writing, I would really appreciate it. Thank you so much, Speaker. I waive the rest of my time. Speaker, did you get that?
Yeah, I'm trying to clarify something here first, Madam Chair. Just to clarify, the before Ms. Roslyn, so before I give the back to you, Ms. So, colleagues, we did receive Ms. Rosalind So and IHS's report, and that report has been sent out on numerous different occasions, but unfortunately, as you know, yesterday and into today, there's been technical difficulties with emails and the whole server, IT, everything. So I know some of you have received that report, but stated that you cannot open it. So Mr. Tom Patero just emailed, I think everybody should have got it now, received actually, Chief of Staff, Shauna So just sent it out, and Mr. Patero uploaded that link too as well. So everybody should be available to access that report now. Thank you. So with that, let me go on to Honorable Otto So, reserve time, 3 minutes, 8 seconds.
Thank you very much, Speaker. Around our 638 facilities that are out there, they are under the Navajo, or the nation. We can go ahead and ask those questions on why things happen, such as what Honorable Delegate Elmer Begay came into his situation related to where individuals were being mixed up with positive COVID patients. So I believe we could ask that, and yes, it is our division director of Department of Health. It's part of her responsibility too. I think she should be able to respond to that. And I don't we know the pandemic is affecting the whole nation, and I know the IHS is tremendously trying to do their part to try to provide adequate health care across the Navajo Nation or Navajo area. One thing is that maybe if we can get the case ratios at our border towns. Yesterday, the president was saying that the border towns are really high and so forth, and we really want to see if Indian Health Services has any information to our direct border towns, such as Farmington or Durango or Page, Flagstaff, Winslow, and you look at what the epicenter releases. You look at Winslow, it says, and it says like 370 something, and yesterday we got a report from the president saying, oh, it's high. All the border towns are high. But yet, the information that's provided is actually, like for instance, Winslow, it says I think it was 374. It said. So, but if you have any information pertaining to our border towns from Indian Health Services, if you could, please provide that information to us so that we know what that numbers are or what the numbers look like there. We know that there are COVID positive people there, but just in general, what is the number? So she not no. So yeah, I don't. That's gonna waste my time, and that's all. Thank you.
Thank you, Honorable. So let me go ahead and go back to Ms. Roslyn. So, and go from there. So,
Thank you. Thank you for that question, Delegate. So with regards to the border towns, remember that the information that I provide and part for lots of reasons, but the information that I provide are IHS numbers only. So I can easily give you the border town information for on the New Mexico side, quite frankly, because those are all federally operated programs for Shiprock and Gallup. So I can give that to you for Flagstaff or Winslow. That information is gathered separately, or everyone's reporting separately to the epicenter. So the data is not. So the epicenter is the one that would have all of the data that's available. When you look at some of the president's press releases, if you look at there's usually a statement down at the bottom that there is a number that is sometimes included that's considered the border town numbers. So I'll try to look for that and see if I can send it back out to share with you how the epicenter or the Navajo Nation president is sharing that information. But the information that I use is only what we're collecting at the IHS facilities. Thank you.
thank you. So with that, colleagues, I don't have anybody else. Oh, never mind. We got some new players in the queue. Vice Chair Smith.
Speaker, Ms. So for the report and for the information out of the snow saggy. My question is, look at COVID-19 that they know. And we've seen what happened with the and then numbers are soaring. And possible the in your future.
Vice Chair Smith,
Doctor-
Vice Chair Smith, you are breaking up in and out. We can't hear you clearly.
Okay. I think the reason why my phone does that is because it starts getting text messages. I don't know why. Every time I want to talk, it does that. Shnanda, has there been talk about a vaccine possibly within this time frame? It seems like it's way off. And then I'm hearing too that these vaccines that's going to be developed
it's not tested on any other form of life. It's going to be directly tested to human beings. And we're going to be like the guinea pigs. Is that what is going on? Does IHS know about this, or does the medical field know about what they're doing with the vaccine on trying to? Because I know they have the flu season, and everybody's encouraged to go get a flu shot, and some of them don't want to get a flu shot. Some of them say, "I'll just go through it through the fall, through the winter, and I'll have my own antibodies and immune system kick in." But that's a big concern on that the discovery of that vaccine. Could you answer that if all possible? If not, maybe later on. Thank you, Speaker. I reserve the rest of my time. Thank you.
What was it? Wait, Vice Chair Smith, serve time with 2:41. Okay, we go on back down to, where am I at? Line up. Madam Chair, Amber Crotty. Sorry.
Yes, thank you,
Three
Speaker,
things at once.
colleagues. Yes, thank you. Shada, thank you for your report. I want to ask, well, first of all, I want to send love and energy and positive healing to not only you, your staff, all of the healthcare workers, from the individuals who are taking calls, cleaning the rooms, making sure that providing quality service to our Navajo people. I just want to give you a heartfelt thank you for the dedication. It was a humble experience to be there at Northern Navajo for the first memorial for all the patients that they lost, for sending them love and light. And I think it's important that we continue to reflect on what this virus has, how it has impacted our families, and so I felt it was appropriate to start with that. And what I've learned and what I continue to learn is your team and the type of skills that they bring to the table. And I'm comparing that to what we have with our Navajo Department of Health and how we need to build up on our side so that we could provide that technical support, we could provide the medical support. And so my question is, can you help me understand how your chief medical officer, the role that they play in decision making? Because I'm not an MD, I'm not a doctor, I didn't go to medical school. And so what I want to inform decisions, and I need to know how to pull that into, as a Navajo Nation leadership, who do I draw from to really look at how do we prevent, mitigate, and then help heal the communities of this virus, to really understand that. So if you could help me understand that, it will help me shed light in terms of what we need to do with our Navajo Cares Fund and other funding and other laws to protect our people. And I'll reserve my time. Thank you, Speaker.
2:33. 2 minutes and 33 seconds, Madam Chair. Let me go ahead and go back to Ms. Roslyn. So,
thank you, Speaker, and thank you for those questions again to Delegate Smith. with respect to vaccine, as I shared earlier, I think it's too early to even start to speculate on where we might be on a vaccine. There's certainly, on a national level, a lot of work being done to try to navigate through that process. But I will make sure that any information that comes out from Indian Health Service as a whole, that we will share that information. I will share that information as it becomes available. Thank you for that question as well. To David Delegate Crotty, thank you so much for your kind words, and I appreciate and always enjoy the opportunity to work with you. With respect to my chief medical officer, who's of course Dr. Loretta Christensen, in all of my years of federal service, the more than 30 years of federal service, I have never met a person that works as hard as Dr. Christensen and as passionate as she is about the work that she does. Moreover, this probably one of the smartest individuals that I have ever met in my career. And I absolutely believe that the nation would go a long way to having a person like Dr. Christensen on staff. I don't, with regards to decision making, she sits side by side with me. I don't do anything. I don't pretend to be a doctor or a physician. I lean on her for all of those areas, and I think that's part of the success that we have had from day one, where she has been the person that has been the driving force behind the medical part of it. She's doing the medical components of everything that we're doing. She clears every policy if she's not personally writing them herself. She's looking at every protocol, again, if she's not personally writing them herself. So that honestly is what Navajo area IHS is. She are the backbone. And of course, in a healthcare setting, you need to have a very good physician to do that by profession. She's a surgeon. She also worked at Gallup Indian Medical Center, so she knows her way around there. She actually worked in New Jersey so she was able to give us information about what was going on in New York, to give us sort of a heads up, because she has her connections there and her colleagues. So we were fortunate to have that. We also have physicians that are at Gallup that had colleagues at the University of Washington in Washington State that were able to give us information in real time of what they learned and how to work through and mitigate some of the patient activities that we were seeing. So we have to leverage the abilities of our medical providers, and that is how I use my chief medical officer. We are on calls almost night and day, and I clear almost everything through her that is medical related. Thank you.
Thank you, Ms. Mazenso, for that. Let me go ahead and move on down. I have a couple of new individuals on the queue. That, Honorable Paul Begay.
Thank you. Thank you, Speaker. Thank you, Sister Rosalind. So, colleagues, been a long day, but very good conversations going on. And I do like to also join my colleagues in expressing my appreciation for your efforts. And it's a very, I know you can't do all things out there, looking from the outside and what's going on at the IHS level on the reservation. You're doing a great job and appreciate it, and we know that our people appreciate that. This virus has created a hysteria. When you really think about it, it could have caused a lot of confusion, but I believe with good leadership from your part, our nation are composed, and we're going in the right direction. Just one issue that I still have with the mass COVID-19 testing that's still going on all over the reservation. We've yet to have any testing done at our northwest corner of the reservation. As I've mentioned before, I believe over a month ago, that I did confer with the mayor of Page, and at that time, his plan was very promising, saying that the testing could be done within a week. But that's, I guess, right now about 3 months has passed. I did try to contact him again, and the last time I made contact with him was probably a month and a half ago. And him working at the Banner Hospital, he told me that he will ask about it again and let me know in a couple of days. That never happened. So I don't know if it's got, if the way he delivered kind of a high-spirited, we'll get it done within a week kind of attitude at that time, is just to cover up his misfortune of communication between the city of Page and what he quoted in the media about the Navajos in Page. So at any rate, nothing ever happened as far as any type of mass testing in northwestern corner of the reservation. I don't know if any such plan would still happen. That's my only thought at this time. And again, I appreciate all the things you've done so far and continue to do. And God bless you. Thank you.
Thank you, Honorable Overgate. Moving on down. Honorable Jimmy L here.
Yate Stigunani on Cosmo Tai, Adoshimaja, Shimayaja Rosen, so ISSA, your director. Kodoya, either Isni Dog, Ye, Dodger, Bioli, he constantly on that it's an condemnation. Oh, you in that time it's not that then. But it's always in other lessons that we learned from this COVID-19. Holland Zago is going to be with this COVID-19. Oye Pahat to Diego. A couple Kudo over this city. A Yaka Shimayas Rosen. So, did it on Bahos and it on Nissi. To a now need a Obahon, not as was but other a content you could. I think so that did we don't have a special isolated facilities in here, then the nutty quarantine no sir. Like I was saying that these facilities in here, then Indian hospital in here and London. They don't have this type of facilities for COVID-19. The Halet on me or the ne or Kana wanted that no, at it without COVID-19 without complete a quarantine 14 days or not or she not they spread out this virus disease. Etos now go yo in Navajo and his talk quality health Indian health service thinks more widely to build a facility that are adequate rooms, maybe 40 or 50 rooms that can be built in every agency and a small hospital that out of Sanazanello. It's not just for COVID-19. It's going to be used for others, our younger nurse, doctor can learn there to these facilities. Lynch kid or Roseland, just to get to give you some ideas. This facility to a quarantine, no. Then here, then,你去那里clinic or你就好干的，但大部分都比但天干，看那看，这个都要说的，可到因好办的，Roseland 都在就 gym 的，二的是不能二这个到care act 反正是比较重视的。那啥的都不给你这个呢，他现在都到这不到个他都到这，late December 30这边的东西，这些或者就是基本上就22的他打其实喏，第二个就是那20的呀的，那个他的白的那一个的的，或者呀，这 facility is important，这个到全要是比It's very critical we need to care facilities, the concerns, there's some with systematic workers or systematic person who comes into nursing home. Nursing home, that's all what is all you can to asa state and then all we need that and all that house facilities so they in heart on the hand about next on case on this. So long that even Delcon, Utah, the F5 agency, and down on the east side too. Mr. Daniel So. Oh yeah, I don't know visible. Mr. Henio. He had never died. Share 24 councilman. This is very critical. It's about the could it not discuss now the say.
You know what?
Thank you very much. Thank you for the time. Thank you very much. Go back on mute.
Honorable Yell here. Time's up. Okay. Let me go back to you, Ms. So.
Thank you, Speaker Damon. Thank you, Delegate Paul Begay. I appreciate your comments and your questions. So I take the issue of testing in the Chi'i or in your community very seriously. If you recall the first schedule that we put out, the Chi'i was put on that schedule and then it was taken off. It was taken off because I was told that we needed to coordinate through Tuba City or coordinate with Tuba City. I will go back to my team to see if we can get it back on the schedule. As I said, one of the things that we're very fortunate with right now is the fact that we do have some testing supplies. And the more we test people in these specific communities, the better off we are, because then we know where the people or where the pockets of positive cases will be. So, yeah, Cecilia, for bringing that up, and I will raise that with my team again. With respect to Mr. Yellowhair, so Shahat, thank you for your comments. I absolutely agree that we have to look at all of our facilities on the Navajo reservation, our healthcare facilities. When I just was planning for new facilities, and we have 4 in the queue right now, by the time they are constructed, they are already too small, because we know that healthcare will always be needed by our people. And so we want to make sure that we bring the best and have the best for the Navajo people. So I completely agree that we need to take another look at our facilities, and particularly as we are dealing with COVID right now. One of the things that we talk about is that this is not going to go away. This is going to have to become a way of life for us moving forward, and how we're going to manage these outbreaks as they happen for us from time to time. So we hope that we learn a lot from this. We hope that we are smarter and more prepared the next time around when we deal with the next season, if you will, of COVID, and also preparing our patients, preparing to have sufficient PPE, You know, all of these things are going to be important for us to move forward and put ourselves in the best position forward. So thank you for your questions, and thank you, Speaker, for the time to talk.
Thank you, Mr. Roslin. So let me go ahead and go back. I got a new player on the board, Honorable Vince James.
Yat Ihana Shinade, Ado Shanakat Anigi Toshe Kahasi. So, Ado Asahi Kideya AAT Tona Gahiki IHS has Ando. Okay, with Jedito, we received a email from Leanne Tree yesterday indicating that Jedito's water project is not a go. And when we met on it a year and a half ago, it was indicated to us as chapters at Jedito to hold off on the bathroom addition. And the reason why they've taken off Jedito project is because bathroom additions are not fully complete. And so in regards to that, if you can relay this information back to your immediate staff that work with the water line issues, that communication needs to be better. And once a chapter does say that can we build bathroom addition, I think it needs to happen. Kadeya, we're out of the loop again because we were told a year and a half ago when we had a meeting there at Fort Defiance IHS that we should not be building bathroom additions. So Adeya, and then I go ahead and yield my time to Shanelle Eugenia Charles Newton.
That, Madam Chair, Charles Newton, 3 minutes and 32 seconds. You good with that?
Yes, I accept it.
Go ahead.
Am I good? Okay, thank you, Speaker. I waived my time prematurely, and I do apologize for that. But one question that I do have is, we have many of our Diné people who are living off the reservation in places like Phoenix and Albuquerque and Denver, and I understand our IHS hospitals there in those areas as well. Can you provide us an update and maybe a report on how our Diné people in those areas? Because we have a lot of our Diné people who are living in these urban areas. I think it would be good if we got numbers of maybe how many are infected, how many have recovered from the COVID-19, and then also how many deaths. I'm not sure if that's included in the information that we receive from the Health Command Center, but I think it's very important for our people to understand what's happening out there in the urban areas as well. So with that, Speaker, I know I can't reserve the rest of my time, but thank you for giving me your time. I'm going back on mute.
Thank you. Pat, let me go back to Vice Chair Smith. 2 minutes, 41 seconds.
Okay, Speaker. Out of the Tossing, Bishmasan. So, my question is, there's that word, and it can be passed from human to animals, animals to humans. Of course, COVID-19 بتوز now. They must be was created da shit shada. Pero da better sheet. And then someone comes by to pet that animal. Social distance body click. And that person touches that animal. Fish better. Will that person catch that COVID-19? 저 에이도 아이시로 아하준다. 엔데레다 주체야 하지 나다 소즈테케야. 에 아도 아도 코 아쉬 밭 아도 좀 네 리드 하노 아니 다 소. 이 리드 타다 오케지. 아도 나 인샬라 아 쿠이치 아다 후이야. 안다 이 Shnanta. Cool. If that's the case, then this COVID-19 is going to run away like a train. Thank you, Speaker.
Okay. That honorable. Okay, moving on down, Madam Chair, Amber Crotty. 2 minutes, 33 seconds. Madam Chair, Amber Crotty, going once, going twice, going 3 times. That, let me go back to you, Miss Rosalind So.
Thank you again for all of those questions. To Delegate James, yes, I will take that question back to try to figure out what happened. So I will circle back around to you and get a response on what happened with the Ajedito. Thank you. Delegate Charles Newton, again, I will look at the numbers for off-reservation Navajo members. Again, the IHS data system where individuals are seen in an IHS facility, we can generally have a wide range of information that will be available to us. And I will search both in the Albuquerque area as well as Phoenix and look at maybe Flagstaff as well in terms of the numbers and see what I can get and share with this body and with yourself. So thank you for that question as well. To Delegate and Vice Chair Smith, I think that with your question with respect to transferring from human to animals, I think that remains a very good question and one that probably has not received sufficient information yet for us to say one way or the other, but we continue to look at all of the things, as we're navigating through COVID, early on we were told it only affects this group of people and only does this and only does that. And we're learning that it's not true anymore. It used to say that the younger children aren't affected. Well, you can see the numbers where younger children are being affected on the Navajo reservation. And so I think as we start to really look at the data, we will learn more about just what we thought we knew about COVID. When I talk to our doctors, they say every day they're learning something different about COVID. And so whether we'll get to the point of getting a concrete answer from animals to transferring from people to animals or vice versa, I think that's still yet to come, Delegate. And as we get information, I'm more than happy to share information with you as best as I can, because if I do that well, then I'm sure that then you're in a better situation to deal with your constituents as well. So thank you very much for those questions.
Thank you, Honorable Rosalind So. That, colleagues, I don't have anybody else lined up. Let me go back to reserve time again. Madam Chair, Amber Crotty. 2 minutes, 33 seconds. Going once, going twice. Madam Chair, I'm McCarty. Going 3 times. That colleagues on everybody in the queue, no one lined up. Going once on the motion to accept the report from Mr. Osmond. So, going twice.
Speaker. Speaker Freeland.
Honorable Freeland, go ahead.
Thank you, Speaker. Good afternoon, Ms. So. Thank you for the updated report. I appreciate the nature of your willingness to share with the body. And for myself, I of course keep in constant contact, or try to keep in constant contact with the healthcare facility in Crown Point, and it's a federal site. We don't have a 638, but that's okay. We also have the Santa Clinic. You know, for me, I'm thinking about us. I'm always thinking about the future and how are we going to deal with a second wave. And you know, you hear of these reports of a potential vaccine that's being developed in England, going through clinical trials right now. But how is that going to ever become a reality when we are still trying to deal with the first wave of COVID? And they say that the virus mutates and it could change, and you know that would mean that they would have to, of course, amend the vaccine again to fit the mutation. I'm like my sister. I'm not a doctor, MD. I'm not a clinician. I'm not a biologist or a chemist. But understanding that, you know, how that works, and knowing that, you know, are you all ready for a second wave of COVID? And are you all, how are we going to deal with this on Navajo should a second wave hit us and it's even worse than the first wave? You know, I hate to sound so bleak about it, but that's anticipation. That's something I'm thinking of what we're going to be dealing with in the future. Secondly, you know, knowing that a potential vaccine could come as early as this fall, you know, how are we going to deal with how are you, or how can IHS get their hands on a vaccine as well? And, you know, knowing that our numbers, you know, have gone up and around the states have gone up, but, you know, how are we going to get a vaccine locally? So that's my second question. So with that, Speaker, I want to reserve the rest of my time. Thank you.
Honorable Freeland, 2 minutes and 27 seconds. Honorable Freeland, let me go back to Ms. Rosalind So. Ms. So?
Good afternoon, and thank you for that, for those questions, Delegate Freeland. So with respect to a second wave, I think that where we are at and in our conversations, we are anticipating the second wave to be worse than what we experienced this go round, the first go round. And the reason why is because we know that will likely come in the fall, which is probably going to be starting sometime in September. And so being ready for that is absolutely key right now. As I shared earlier, that means adjusting all of our facilities to make sure that we are not commingling possible flu patients with COVID patients, with just other patients that need medical care. So looking at all of those systems, and we have a lot that we have done that we can learn from. And we need to now be in the phase where we're adjusting where we need to adjust and pivot where we need to pivot in any aspects of everything that we have done. I will say without a doubt, the coordination between the Indian Health Service and all of the healthcare facilities on the reservation, 638 IHS and the Navajo Nation needs to be a step in step. There has to be there has to be a sort of a single way of how we're going to address this in a more coordinated, efficient manner, because it will be overwhelming. With regards to vaccine, though, I think that we can look at um, how we have addressed the flu in the past. Of course, the flu has different strands as well, and so we can anticipate that, whatever vaccine we're going to give out for flu, based on what we anticipate will be coming forward, that will likely be what we will look at for how we will be utilizing a vaccine when it becomes available. Now, please keep in mind that we don't want to be the first ones on the bandwagon to take the first vaccine that comes in, because there has to be clinical trials. There has to be clearance, and making sure that we all bring to the Navajo Nation what is safe. At the same time, Indian Health Service is also positioned to make sure that we're tracking this on a national level as well, to be able to get what we need when we need to have it. So that is where we are at in preparing for a second wave. We believe that it will come. We believe that we have learned a lot. We're guessing right now, in the meetings that we've had last week, we have 3 good months of when we're going to be able to prepare for. And that's really looking at what Delegate Yellowhair said in terms of we need isolation units, we need facilities, we need a robust plan, in terms of how we're going to mitigate what we're dealing with right now, to keep the numbers down, to ensure that people continue to social distance, but the gathering of people will have to continue to be done in a safe manner, with following all the rules, being able to wash our hands, while we're also trying to address the water situation for the Navajo people and to improve that, so we do not have any vulnerable spots out on the entire reservation. So it is definitely a heavy lift, and all of us understanding and being on the same page and working together is going to get us to where we need to be, but it will be a heavy lift. Thank you.
Thank you. Ms. Roslin, so with that, let me go back to okay, moving on down. I have nobody in the queue, so I'm going to go back to reserve time. Honorable Mark Freeland.
Okay, am I left, Speaker? All right, thank you. Thank you for that, Ms. So.
2 minutes and 27 seconds.
Okay, thank you, Speaker. I'll make it quick. Just another second question, or a couple of questions in regards to potential second wave. It's understandable that the virus does, or the strand does mutate under cold conditions. I think if I'm not correct, please correct me. But also, are you all do you all have sufficient amounts of PPE and sufficient amounts of testing as well available at this time? And I guess now is a good time to stockpile, and now is a good time to start thinking about, potential, preparedness. So are you guys ready? Or is IHS Navajo area ready? Not the 638s, but the federal facilities. Thank you, Speaker. I'll waive the rest of my time.
Let me go back to Ms. Roslin. So,
thank you again, Delegate Freeland, for that question. Yes, I believe we are ready with respect to PPE. There are still a few items that there is a backlog on. The small sizes of the N95s are ones that we're still searching for and still looking at. We are anticipating that we will stockpile as much as we can and as much as we have to, in securing more space, storage space to secure this information or these products, because again, we have to be ready. With respect to testing, right now I have 2 facilities, 2 hospitals that have nearly 10,000 tests that we can do now. And so Even with that, we want to make sure that we are stockpiling, if you will, everything that we can preserve at this point to make sure that we are ready for the next wave, but also to keep the numbers down now so we don't get ahead of ourselves and end up back in where we were about a month ago. What we are seeing, though, and I think what we have to keep in mind is that these places that are hot around us, like Phoenix and Utah and these places, they are backing up. And you're hearing on the news that some people are, it's taking 14 days to get their results. You know, we had it down to 24 to 48 hours. And now we're seeing that gradually go back up again because these lab cores or lab systems that we utilize where we have to send out labs, those are backing up all over the place. So that's causing a little bit of a stress for us right now. But, you know, thank goodness, I guess we were in front of all of this and we were able to do what we did early on, including moving out patients. And so we're not caught up in the Phoenix situation right now, as we're monitoring those reports on a regular basis. So I think that we have done enough. We will continue. As I said early on, we have a whole team that's just buying PPE to make sure that we have sufficient stock, not just for now, but anticipating what we will need in a few months. Thank you.
Thank you much. So, that, colleagues, I don't have anybody else to reserve time. Went once, went twice.
Daniel, Speaker.
Honorable Herman Daniels, go ahead.
Thank you, Mr. Speaker. Arunana Kodos, Nano Senegi, 24th Navajo Nation Council. Staff, Manos Fokoto, Arunana Kodo, Shikido Shitane, Dino Shiflagi Kodo, Atawi Fago. Aruna Jonoshi Kodo, Dino Shiflago, Arunana Kodo, Shan Kodo, Miss Robin Poe, Great Nan Sashade, Nan Snart Igita Kodo, Kanegi Mutuin La from IXF. I gave back here in Kodo, Arunana Kodo, what in front or in front or just potential second wave. We are just not fly, but we are not Seneki. She said, we do a what it is, second wave. Should the NATO now she gave us even a what it is, so it's a lot. For the handle, even as you go to what it is. So you get body or you back in here. That it is in the course of so that he needs they need that 24th Navajo Nation Council, Arunana Kodo, along with our chapter officials throughout the Navajo Nation, 110 chapter officials out of his staff, so chapter staff, so that he needs they need that Kodo. Hit the neck or Nani Pino. But they be second wave, but to 80 says over ya on is so let's go. Don't not he need Edo and he kick Edo, Ben and Hino, I can Hino. Don't need such instance. So, segundo, Aronan, which 8 to this. I've been not there to say. Oh, that is from his large what or see. They don't get it on a snake. It's just like any could only get on a snake. It's large what or see. They know for this and other than other best, no AB guns, no. A codo, Becky had a wheel about 9 eggs, I could 8 or 8 of Zonda. So, it is about it. So, don't hear it. I mean, big up, moving forward. Let's get out of this pandemic. Let's educate our people. We need to get serious. Moving forward, let's get serious. So now, I need to up and I can be. But not the Shiniki could not kick a lot of stake with all. Donado needs a try to that. So idéet och bandsatt och läppedosman och sen so ada hoti no yat eto lesson. So idea kodo. I don't know. I appreciate the report from IXS kodo English kodo. So thank you very much kodo, Mr. Speaker.
Thank you. Daniels. Let me go back to Mrs. Roslin. So,
Thank you, Speaker. I realize that this is a hard sort of process that we are going through, that we have been through. And I guess I'm a person that's more of a realist. I want to know what is in front of me because I need to prepare that way. So I apologize if my sort of frankness is coming across a little bit firm and strong, but we have to be prepared for what's yet to come. If it doesn't, then that's good. But if it does, then we still have to be prepared so we don't lose any more people and we don't go through this maybe as harshly as we did this time. There were times when clearly we were stumbling around to try to make sure that we're trying to find solutions. So I thank the council delegates. I've had tremendous amount of support from many of you, if not all of you, to help. And I hope that I hope that I'm giving you the information that you need that helps you do what you need to do in your decision-making processes. So I'm just thankful for the time that you give me. I'm thankful for the questions that you present to me. I believe that I am accountable to this body, and I will continue to do so and help out in any way that I can.
hey, colleagues, I don't have anybody with reserved time. Nobody in the queue. Going once, going twice, going 3 times. Accept the report. Ms. Roslyn So, representing Indian Health Services. Roll call vote.
Honorable Elmer Begay.
Vote green.
Honorable Elmer Begay votes green. Honorable Begay Jr.
Paul Begay votes report from IHS. Delegate Yelgay Jr. votes green.
Honorable Callan Begay Jr. votes green. Honorable Paul Begay Jr.
Paul Begay votes green.
Honorable Paul Begay Jr. votes green. Honorable Nathaniel Brown. Honorable Nathaniel Brown.
Delegate Brown votes green.
Honorable Nathaniel Brown votes green. Honorable Eugenia Charles Newton.
Charles Newton votes green.
Honorable Eugenia Charles Newton votes green. Honorable Amber Kenneth Bakradi.
Delegate Amber Kenneth Bakradi votes green. Thank you.
Honorable Amber Kenneth Bakradi votes green. Honorable Herman Daniels Jr.
I vote green.
Honorable Herman Daniels Jr. votes green. Honorable Mark Phelan.
I vote green. Thank you. Phelan votes green.
Honorable Mark Phelan votes green. Honorable Pernell Halona. Honorable Pernell Halona.
Hello?
Honorable Pernell Halona.
Green.
Halona votes green.
Honorable Pernell Halona votes green. Honorable Jamie Henyo.
Jamie votes green.
Honorable Jamie Henyo votes green. Honorable Vince James.
Delegate James votes green.
Honorable Vince James votes green. Honorable Ricky Ness.
Delegate Rick Nez votes green.
Honorable Ricky Nez votes green. Honorable Carl Slater. Honorable Carl Slater. Honorable Carl Slater does not vote. Honorable Raymond Smith Jr. Honorable
Green.
Raymond Smith Jr.
Green.
Honorable Raymond Smith Jr. votes green. Honorable Wilson Stewart Jr.
Green.
Honorable Wilson Stewart Jr. votes green. Honorable Otto So.
I vote green. Green
Honorable
salad.
Otto So votes green. Honorable Charlene So. Honorable Charlene So. Honorable Charlene So did not vote. Honorable Daniel So.
Daniel So votes green.
Honorable Daniel So votes green. Honorable Eugene So.
I vote green.
Honorable Eugene So votes green. Honorable Thomas Walker Jr.
Thomas Walker votes green.
Honorable Thomas Walker Jr. votes green. Honorable Edison Winika.
Green.
Honorable Edison Winika votes green. Honorable Edmund Yazzie. Honorable Edmund Yazzie. Honorable Edmund Yazzie did not vote. Honorable Jimmy Yellowhair.
Jimmy Yellowhair votes green.
Honorable Jimmy Yellowhair votes green. Going back up, Honorable Carl Slater. Honorable Carl Slater. Honorable Carl Slater did not vote. Honorable Charlene So. Honorable Charlene So. Honorable Charlene So did not vote. Honorable Edmund Yazzie. Honorable Edmund Yazzie. Honorable Edmund Yazzie did not vote. With that, Mr. Speaker, you have a vote of 20 in favor and 0 opposed. Mr. Speaker.
Thank you. That 20 in favor, 0 opposed, motion carries. Thank you very much, Ms. Rosalind So, for being with us this evening.
Thank you.
Moving on down. Item number B under oral reports. Attorney General, Ms. Doreen McFall, are you on the line?
Yes, Speaker, I'm here.
Great.
All right, good evening, Speaker. Good evening, Honorable Delegates, Madam Chief Legislative Counsel, Madam Chief of Staff, colleagues and staff and members of the public that are listening in. My name is Doreen McFall. I serve as the Navajo Nation Attorney General, and I oversee the Navajo Nation Department of Justice. Just to share some preliminary information about my department, just because we do get calls from the public for legal assistance, I just want to share that the Department of Justice is established by statute to provide legal services to the Navajo Nation government. So our clients include the 3 branches of government, the executive branch, divisions and programs, and the 110 chapters and entities. The Department of Justice is also charged with administering the Office of the Prosecutor, and that office oversees the prosecution of adult criminal and juvenile dependency cases, white-collar crime matters, as well as child dependency and child in need of supervision cases. The Department of Justice is also charged with administering the Navajo Hopi Legal Services Program in Tuba City, which serves and represents relocatees for the Office of Navajo and Hopi Indian Relocation. And Council, we've prepared and submitted a written third quarter report that identifies many of the various legal issues and matters that the Department of Justice is addressing. But I want to first start by highlighting some of the staffing updates for the Department of Justice. And first, as you know, Assistant Attorney General Warner is retiring this month. This week marks her 4-year anniversary with the Department of Justice. And anyone who has worked with Jana knows that she's been an incredible asset, not only to DOJ, but to the Navajo Nation as a whole. And we will certainly miss her legal mind and her diligence and her grace. And thankfully, though, Ms. Warner has been preparing for retirement for quite some time, and she is leaving our Tax and Finance Unit in great order. And while we will miss her presence at DOJ, she's made sure that TFU won't miss a beat with any transition. And so we want to report that we've hired Mr. Mel Rodas to serve as the Assistant Attorney General for the Tax and Finance Unit upon Jana's. So if anyone can fill Jana's shoes and live up to the high standards that she has set for TFU, it is Mr. Rodas. So I also want to share that Assistant Attorney General LaTanya Johnson has moved from our Economic and Community Development Unit, ECDU, to our Human Services and Government Unit, HSDU. And she's actually been doing double duty, overseeing both of those units for the past several months. But in her new role as the AAG for HSDU, among other things, she is already working closely with the acting chief prosecutor on ICWA matters and dependency cases. And this will translate into better outcomes for our Navajo kids in care and for our Navajo families generally. And so with LaTanya moving to HSGU, Catherine Belzowski is serving as the acting AAG, Assistant Attorney General for the Economic and Community Development Unit. So that's some current staffing changes just so that the council is aware. But also regarding new staff, I want to share that the Department of Justice has added 5 Navajo women to our legal team, including some very experienced legal staff and some brand new law grads. So Advocate Barbara Willetto is back at DOJ, coming most recently from DNA Legal Services, and she will work in HSGU on child support matters. And also coming back to DOJ is Miss Michelle Brown-Yazzie, who has most recently served as the chief judge for the Mescalero Apache Tribal Court. And I believe she started her career at DOJ, and so we're very happy to have her back. She'll be working with the litigation unit as well as on legislation, as well as assisting the Deputy AG and I with special matters for OAG. So we've also hired 2 new University of New Mexico law grads, Jordan Oglesby and Naomi Droll, and they're assigned to ECDU, and they will also assist with the legal needs of the 110 chapters. As you know, Roderick Biguet is a solo attorney for the chapter unit right now, and so we certainly want to support him in that capacity, as well as the legal needs of the chapters. And finally, Cynthia Freeman is a new Arizona State University law grad, and she will also join DOJ's chapter unit next month. And I intended to send an email sort of summarizing their bios and information. So I just sent that out now. I apologize. I was working on that and then just neglected to push send, but you have that now. But in addition to the new hires, we also have several interns that are working with DOJ for the summer month. In total, we have 89 employees, including 53 legal staff and 36 support staff. And we currently have 11 vacancies at DOJ, 11 at the Office of the Prosecutor, and 4 within DOJ. And so that's the lowest number of vacancies during this administration for the Department of Justice. So apart from the staffing issues, the Department of Justice has continued with our charge to provide legal services to the Navajo Nation government as best as we can, with our team primarily working remotely. And we do have some challenges, as I'm sure all the departments who are working remotely right now have, with respect to technology and internet access. But also being able to access our case files remotely has been a challenge both for the Office of the Prosecutor and for DOJ. And then just some challenges for some of our staff not having appropriate workspace or equipment at home to perform their job functions. But we are continuing to do the best that we can to be as productive and responsive and efficient as possible. We do have some essential support staff that come in to the office on an alternating basis to keep the office functional, dealing with the RFSs, which a lot of them are coming in electronically now, is great, but also just to keep up with the legal notices and the mail that comes in and things of that sort. So despite being able to work remotely for the most part, it does present a significant challenge when there is a need to meet with clients, for example, or for our prosecutor's office to meet with victims or witnesses and families and defendants. And so we just noted that in our report as a particular challenge during the pandemic. Speaking of the pandemic, we've been working overtime on COVID-19 related issues, as well as our regular non-COVID issues. And then we do have some issues that are sort of a hybrid of both COVID and non-COVID matters. And as the council knows, we Department of Justice was tasked by the Health Command Center to serve as the donation branch for the COVID-19 donations that are coming into the nation. And so we've regularly reported about those activities this quarter, both to the Budget and Finance Committee as well as on the Office of the President's town halls to provide information relating to donations. And it's a lot of work for our Department of Justice team, but as we've reported, it's also very rewarding work to talk to folks who want to share, share their heart with the nation and their generosity. With respect to CARES matters, and I'm just going to highlight some of the matters that are in the report for this quarter. The Department of Justice has been involved in litigation against the U.S. Treasury regarding the CARES Act funding, particularly the allocation for the Alaska Native corporations. That is an ongoing case. It's on appeal, and we've regularly reported on that matter to the leadership, and Mr. Spruan has appeared on a couple of town halls to discuss that case and the nation's involvement and sort of the status of the case. I know there was questions to IHS regarding the alternative care sites. Our office has worked on various issues relating to the alternative care sites, including the agreements, leases. We've been figuring out how to use hotels for quarantine locations, for example, and working with the Health Command on those issues. We do have an issue that's particular to DOJ and alternative care sites. We are trying to figure out a way to have a secured alternative care site to use for involuntary commitments. And so I know that some delegates have asked about this. The President's office has asked about involuntary commitments for folks who refuse to stay home, who have tested positive. And in order for our prosecutors to effectively secure an involuntary commitment, we need to be able to inform the court where a particular individual needs to be detained or committed. And we've been working on that, I want to say, since the very end of March, the very beginning of April. and there was some discussion to use one of the vacant juvenile detention facilities. And we've had lots and lots of conversations about that, but haven't really progressed to secure a facility that the nation can use for involuntary commitments. And I do want to share that that was a big issue this quarter. The Department of Justice has also assisted with the drafting and review of the public health emergency orders, as well as issues regarding their enforcement. And so our Office of the Prosecutor has a dedicated phone line to answer questions regarding citations that anyone receives, violations of public health emergency order, curfew violations, and the sort. And any questions really about the prosecutor's office, their services during the pandemic. And on page 14 of the report, there's a summary of the COVID-19 citations that have been referred to the prosecutor's office for prosecution, and there's over 1,000. Because of the limited services that the judicial branch and the courts operating currently with minimal staff and doing telephonic hearings only, that does present some challenges for prosecuting not only those kinds of citations, but really any of the other complaints received. And so there is some work on our prosecutor's office side in ensuring that they're filing complaints where, for example, the defendant is in custody and there's grounds to seek a warrant with the complaint, and sort of the non-petty offenses that might further clog the court system and create delay and justice at this time. So in addition to those issues, under Rod's direction, there have been a lot of legal needs that the chapters have had during the pandemic, and he's outlined those significant chapter issues starting on page 17 of the report. And I just wanted to highlight that, and we are doing our best to be as responsive as possible to the chapters. We've also, sort of pandemic related, been dealing with some intellectual property issues and trademark concerns, as well as risk management issues. There are issues surrounding employees and employment, returning to work, for example, and the planning for that. Also been involved in many discussions and meetings regarding the closures and reopenings of schools and businesses and the government. The Tax and Finance Unit did provide training in May to the Council on eligible uses of CARES funds. And then our office was also involved in a report to the UN on the effects of COVID-19 on the Navajo Nation. And so just wanted to share those as sort of highlights of COVID-related matters that we've worked on during this quarter. In terms of non-COVID matters, I did a report to the leadership on the judicial funding litigation that had a positive result for the nation, and we can provide an update on that once we know whether the United States is going to appeal that decision. We are continuing with the Navajo Hopi Legal Services continued litigation on the O'Neill appeal. One thing I want to note about the Navajo Hopi Legal Services for this quarter is that the Deputy Attorney General and I visited the office there into the city to address some needs related to the building. And we were informed that that was the first time since the Shelley administration that either the Attorney General or Deputy Attorney General had visited that office. The last time there was anyone there, it was under the former director, Betsy Snow. So I did want to share that that was one of the things that we has been on our sort of to-do list, and we did that this quarter to address those concerns. Regarding our ECDU, Economic Community Development work, has done a lot of work this quarter working with CPMD on issues relating to administration of Sihasan projects as well as construction contracts. ECDU did present recently to NABI on the quadrilateral agreement and the other agreements related to Antelope Point there, and provided a recommendation to the leadership. In the written report, there's an ICWA update on page 23 that I wanted to highlight, and just to share, and I've shared this during our litigation updates as well, that our department is committed to continuing to work on being responsive to the legal needs of the Indian Child Welfare Act unit. And as I mentioned at the beginning, that results in better outcome for our Navajo kids. Other issues relating to tax commission matters. The council's aware of the Family Dollar Store liquor license matter, direct investment matters with the investment committee and the budget and finance committee. And then our tax and finance unit has been working on the 2021 comprehensive budget planning with the various departments and the leadership. Also, there's a couple bankruptcy matters that we've been involved with this quarter, including the opioid litigation and then the Frontier Communications bankruptcy, ongoing water rights litigation and settlement activities. That's in the report starting on page 39. And we were scheduled to provide a water rights litigation update to the council in March, and that was delayed due to COVID-19. And so we certainly want to provide that report to the council as well as a litigation update. Our last full litigation update to the council was in February, and so we wanted to suggest a follow-up litigation update either at the end of August or the beginning of September, but we do want to provide the water rights update separately just because it's such a huge and important topic, and we didn't get to it in our February litigation update. In terms of sort of hybrid matters that are sort of exacerbated due to the current pandemic, we've been addressing needs with the various executive branch divisions and programs regarding emergency procurement. Issues related to voting rights have been prominent this quarter, as well as issues relating to hemp cultivation. And the Department of Justice provided just recently 2 short reports without much discussion with the leadership. And I know there was a recommendation to do a 4-hour work session with RDC and maybe with NABI as a whole. And I know that this is a matter of public concern, and there are portions of that report that we can provide in a public setting, and we are happy to do that. And then just finally, our department owes NABI a report on line item veto authority. And I just want to share that we've been actively working on that report, and it's a complex and complicated question that we want to make sure that we get right and provide, the best information to the leadership. And so I just wanted to share that we expect to have a finalized written report on that tomorrow. And I will send that to council once it's been finalized. So that's the extent of my report. Thank you so much.
Right on to 20 minutes. That, colleagues, is there a motion to accept Madam Attorney General's report this evening? Going once.
Daniel.
Motion by Honorable Osco. Second by
Daniel,
Honorable, Honorable Herman Daniel. Okay, colleagues, with that, got Che, Honorable Keelan Begay on the board. Go ahead.
Speaker, Calvin.
Go ahead.
Specific, just short request if DOJ is continue working on the Law and Order Committee oversight requests the consent decree issue. That's one area that I believe that continue needs to be addressed. I don't mean to overstep the Law and Order Committee authorities, but at the end of the that's the only question I have of the speaker, so I reserve the rest of my time.
That reserve your time at Honorable Keelan Begay at 4:14. That. Have anybody else on the board?
Delegate Paul Begay.
Going twice.
Delegate Paul Begay.
Go ahead.
Hear me, Speaker? Hello?
Yes, can hear you.
Okay, sorry. Thank you, Speaker. Ms. Paul, thank you for the report. Really quick, I know that the quadrilateral agreement is coming up around the corner. I believe the deadline or the date for renewal is September, a couple months away. And I had asked to have DOJ and legal services work on putting together the legislation. I just wanted to see what the status is on that. I checked on that yesterday, and I didn't get any answer or as far as where it's at or how much work is going to be still needs to be done. So I'm wondering if you had any update on the status of that legislation. I need to get it so that it's a request to extend the deadline for at least a year. Hopefully they'll give us time because of this virus going around. It did not allow us enough time to address some of the issues that the communities of Tachi and Copper Mine, Kaibito, those along the Glen Canyon National Recreation Area, they're very concerned about certain parts of that agreement that was put in place 50 years ago, and they need to make some new amendments. They need change in that new agreement. So that's the whole emphasis on asking for an extension of the deadline for at least a year. So that's my only question is what's the status on that, or if you know of what the status is. Thank you. Appreciate it.
Thank you. With that, moving on down. Madam Chair, Amber Crotty.
Hello, are we still there?
Madam Chair, Amber Crotty?
Sir Damon?
Yes.
Sir Damon, can you hear me?
Yes, I can hear you.
Thank you. Thank you. Did you hear anything?
No.
Okay. Thank you. Well, I said thank you for the report. And looking at page 40, the Office of the Prosecutor, there's vacancies that are and I need to and I didn't hear you give an update in terms of these are critical areas. The violence on Navajo Nation, regardless of what the administration may say, there is stories and there's indications that during this lockdown, violence has increased as individuals are at home with their perpetrator, with their abuser. In my district, we had to deal with an individual who has a long history of domestic violence and eventually killed his wife. And so I think I would need to know what is the status of those vacancies. And I also read in terms of the Office of the Prosecutor outgrowing Department of or DPM. Yes, the former Hess had already had conversations with the general and the chief prosecutor that there is language in there that the chief or the Department of Justice has the authority to vet out these potential candidates. And I feel like now we're back to square one. And so I would like to know, when are we going to have a chief prosecutor so that these areas can be addressed, so that our people can find relief in this system? Right now, there's no real justice out there. And I think I'm concerned also in the delay of the Title 17 amendment, how we were going to strengthen the sexual assault violations, redo the Family Violence Act. And I have heard little to no updates from this administration, from this DOJ on how we're going to move forward. And so I'd like those questions answered, Speaker, and I'll reserve my time. Thank you.
$2:34. Serve your time, Madam Chair, Amber Crotty. That, let me go back to the Madam Attorney General. Go ahead. We'll give the floor back to you.
Thank you, Speaker, and thank you to the delegates for questions here. Regarding Kiawan Bigay's questions about the consent decree issue, I guess one thing I should have also reported, just in terms of staffing, is that the attorney for the Department of Justice that was assigned to the Department of Public Safety resigned from DOJ last quarter, and that position has been advertised with 0 applicants. And so just recently, we've outsourced that work to an outside law firm. We haven't provided all of the assignments for the DPS work to the outside firm. There's some things like the consent decree that will go to our litigation unit, since it's active litigation that has been ongoing for several decades. We've provided a couple of reports on the consent decree issues and updates to our oversight committee, and we're happy to do a follow-up report on that. I mentioned in my my opening comments that our last litigation update it was in February, and so that's probably the last time we've reported to the leadership as a whole on the consent decree issue, and so we are happy to include that again in an update. And Mr. Begay, I'm also happy to do I don't want to call it a one-off, but when there's a significant event in any of our litigation matters, I try to provide that information to council, just so that you're aware of things you might see in the newspaper, or just aware of decisions that are being made that impact the nation with respect to our litigation matters. And so I'm happy to do that for the consent decree, and just sort of give everybody a status of where that is, where the last action in the litigation, and then sort of what the next steps are. So I'm happy to do that and to provide that to the council in writing. So I'm going to make myself a note to do that. Regarding the question from Delegate Paul Begay regarding the quadrilateral agreement and the business site leases up there at Antelope Point. Just in terms of status, I understand that there was a call last week between the Department of Justice and the Office of Legislative Counsel, and I think there were several delegates on the call as well. But their Office of Legislative Counsel is working on that legislation. I am aware that there's a follow-up meeting this week between ECDU and CU here at DOJ to staff the quadrilateral report. And so that's the current status, and I don't know if OLC has a more current update regarding that particular legislation than I do. And then with respect to Delegate Crotty's question, I have to look at page 40. Couldn't get there quite quickly enough to see your question, or to understand your question in context. And you were kind of breaking up when you were talking, so I think I caught most of what you said, but if I don't answer all of your questions, please let me know. But one thing I do want to share regarding the violence increase during the pandemic is that our Office of the Prosecutor is not seeing that upspike in terms of reports that are referred to the prosecutor's office for prosecution. And so while we understand that there's the reports of the increase in, for example, domestic violence, unfortunately, on our end, we're not seeing that to be able to address it through our justice system. And so I just want to share that with you so that you're aware that there's a break somewhere in between the upspike in domestic violence and what we're seeing here at the Department of Justice in terms of the reports. Our Office of the Chief Prosecutor position is advertised. We haven't had any applicants for that position. We did experience some challenges in updating the JVA for that position. I think the JVA that was previously used excluded some statutory requirements. And so we spent a lot of time with DPM ensuring that the statutory requirements for that position were actually included in the JVA. Because unfortunately, I think that folks who may have applied would get, and we do get to see those when they do come in, they would get notices that they were deemed unqualified without really any explanation because the JVA didn't include the statutory requirements. So that is included now. We've updated that. I know with respect to some of the vacancies at the Office of the Prosecutor, they've been doing, and we've reported to our oversight, that they're doing a, what's the term that she's using for this, but sort of reclassifying positions and sort of reorganizing their office because there was some unnecessary distinction, for example, between prosecutors and advocates who were serving as prosecutors in terms of discrepancy in pay without any discrepancy in responsibility. And so there was a lot of work going into readjusting that within the office. And so position reclassifications, those are the kinds of things that have taken a really long time in the HR process to get finalized. We've also had some, really frustrating issues in getting positions posted, including grant positions, where the grant calls for example, a prosecutor, and the position is advertised that includes an advocate. And, we don't have any one person at DPM that's assigned to our prosecutor's office, and it seems like every time there's a distinction between an advocate and a prosecutor, we get some pushback from DPM. I think that there's some folks that don't understand that prosecutors are lawyers. And so there's just been some very sort of repetitive challenges in having these legal positions filled, and struggling to have that sort of translated into these positions. And then just with respect to the Title 17 question, there hasn't been a current report on those efforts. We did staff some of the Title 17 issues with the Office of Legislative Counsel, and that work has transitioned to the Office of Legislative Counsel. And we are certainly willing to help facilitate the updates that are needed to the Title 17, but we really need direction from the leadership on the updates that are needed. And so I think there was a lot of time spent sort of putting in, what various programs and departments wanted in the code, but we really need direction from the leadership. And so I think there was a decision that probably best comes from the Office of Legislative Counsel working directly with the leadership to get the input that is needed and the direction from the leadership on Title 17. And so we haven't had a recent meeting about Title 17, but I'm certainly willing to coordinate with the Chief Legislative Counsel to get that back on the radar so that we can provide an update to the leadership. Thank you.
Thank you, Madam Attorney General. Let me go ahead and go back on. I have a couple of new individuals that are lined up in the queue. Honorable Stewart. Can you hear me? Honorable Stewart. Going once, going twice. We're going down. Chairman Daniel So.
Thank you, Speaker.
Yes.
Other colleagues of the 24th Navajo Nation.
Chairman Daniel So, I can't hear you, sir. Chairman.
Hello?
I can hear you now.
The system had me on mute. I double clicked the star. Basically, Speaker, and then
colleagues of the 24th Navajo Nation Council, Madam Attorney General, the Yazzie Martinez, and the Impact Aid. The Navajo NABI committee had already passed legislation requesting public education department not to intervene in the Yazzie Martinez decision, as well as not to appeal the U.S. Department of Education's decision on Impact Aid. However, they did, and we're just fortunate that the new judge maintained the suit. And it's very interesting. The state of New Mexico has a consent decree because of the riots at the state penitentiary. And it just seems like now we have to have a court order to maintain the Yazzie Martinez decision, respective of our Navajo children. And it's really disconcerting that it had to take that lawsuit. And we also have, with the Impact Aid, monies that are due to serve our children is being redistributed statewide. And that's something that ought to stay focused in your office. And thank you for hiring Shibizi Michelle Brown Yazzie. He's from Torian. The chapter students from Counselor Torion and Ojo Encino feed into the Cuba School District, and they are one of the main plaintiffs in the Yazzie Martinez lawsuit, as well as on the Impact Aid. The other part I really want to emphasize is voting rights. Does voting rights apply to both a primary and a general? And how did it apply when most recently a election was postponed? Were not the voters disenfranchised? However, in this aspect, we are still staging a general election, and are we denying voting rights by just having one election for the chapter officers and the school boards and the land boards and the grazing committees? That would be the extent of my questions. Thank you. Mr. Speaker.
Thank you, Chairman. Okay, with that, let me go ahead and go on. Now, let me go back to Honorable Stewart.
Okay, good evening to the Speaker and colleagues. Otto, Attorney General McPaul, thank you for your report and reading it and following along as you went through it as well. Cool. The only thing, point out a few things that to me are a concern, as well as probably to my colleagues. And also the community members out there that are listening. The other one is, some of them are the citations that you stated from this COVID-19, the stay in shelter citations that have been issued. A lot of that, when I go to the chapters or communities that I visit, they talk about that. They ask, how is that going to be? What policies are put in place for that? And also, how strong is the court actually going to be towards that individual? Because they say that a lot of our judges, they're real lenient and they don't prosecute them, and they say, that's because, they know that they can get away with it. So they're asking and they're pleading with the judges to make sure that these individuals do pay that fine, because our police officers are out there issuing these citations. They don't know who has that virus. So that's one thing that they're asking for. The other one is the contributions that have been coming in, the monetary contributions that have been stated throughout this week up to now, and probably will be continued to be brought up in the future. Are those, how it's in the report that you facilitate the contributions that have come in. Is that working with OOC as well? I know because she mentioned it in her report as well, just to clarify that part. And then the other one is, congratulations and welcome to the 4 staff that are on board now with your office, and during this time, you continue to hire and to recruit, that's really something to see out there. And then the other one, that I read in the report also was the equipment, Navajo Nation property, that's taken home, with the things that are happening now across the reservation. Even within the small communities, we have elders whose homes have been broken into when they're home. What is the process on that? Did it go through risk management? Did we get insurance coverage on all that? Is it all? I know when you purchase it, any department purchases an item that is already recorded, is given a tag, should be given a tag, but most times they're not given a tag either. So how is that being recorded, that equipment that's at home? Those are the only things I have, Mr. Paul. Thank you again. Going back on mute, speaker.
Going, Honorable Stewart. Pat, we're going down. Honorable Brown.
Hello? Can you hear me, speaker?
Yes.
Hello, speaker? Can you?
Yes.
Okay. Sometimes I'm not really sure. I press my own mute button on my phone, and then there's another mute button, the star. But thank you, Speaker. Thank you, Madam Attorney General, Attorney Mr. Paul. Thank you for your presentation. The one question I have, my first question is, I know in the 23rd Council, we have been meeting at the Attorney General's office before with Kayenta Township and some of the commissioners, as well as our Navajo Nation police, prosecutor, and some other stakeholders. And this was, we talked about amending Title 17, and it started with bootlegging. In my communities across are still asking leadership to do something about the drug sales and our meth dealers and bootlegging on the Navajo Nation. I just actually dropped off some sanitizers. Thank you to Madam Chair Eugene and Charles Dune for your donation. I just dropped one off at the shelter. And when I was there, the director told me that there's a grandma from Loop area who lives remotely, and she has a man who visits her. She kind of has Alzheimer's. Unfortunately, these people take advantage of her in many ways, and because of the remoteness we're going to follow through with checking with the police, with the Navajo Nation police, and see what is really going on. We do know that she seems to have some dementia, but we know that people, our Navajo relatives who are vulnerable in this population, they do tend to get taken advantage of, whether it be monetary, mental abuse, elder abuse, even being sexually trafficked. And I think sometimes the mind can only handle so much, and they go over. And with that, we are still combating bootlegging here on the Navajo Nation. And I have asked on social media to send me pictures and videos. I wanted to continue to follow through with this. And with my ask is, I wanted to restart even through conference calls. I know you're extremely busy, but the end result is really, are we really looking out for the best interests of our people, and how do we protect them? And one way is through really looking at the bootlegging, and then making the law stronger, and then prosecuting them. Some of our own relatives who are struggling with these addictions, how can we help them? I really want to go back and revisit the Title 17 group with all the stakeholders and start talking about this. And again, I also don't mean to overstep the boundaries of Law and Order Committee, but maybe I can take this report. I know we did get a report. We did receive a report from Chief Francisco and Director Delmar before. However, I still want to, I need your help and your guidance, and helping our people who are requesting help time and time again. I know this is some of the reasons why COVID was increasing on Navajo, is because these individuals, they keep selling, and then our people kept drinking and dealing with all these other issues. So if we can restart that group, that would be good. And then how can we help from council? I reserve the rest of my time, Speaker. Thank you.
Thank you, Honorable Brown. Serve your time 1 minute and 3 seconds. Uno down, Honorable Jamil here.
Hello, Yate, Speaker. Shouldn't Ajin. Yate to Shinat Anya 24 man. Hunderten his hold to Alapanit about Ani. Shayati, this my concern about this. Bigay Donna Dictas Nihilafne Akunde. Isn't a phone cracky? I have issues with my telephone. As auto, check call the slot. Kunde, good General, thank you very much. Growing to it sounds like we're a council chamber. Growing a judicial system about this sounds called Ishkati. The way back about how Tanzel, the Arje, that is also. There's only file a hearing and use a Navajo Nation judicial system isn't the best process. Fairness decisions on the judges aren't presiding over hearings on it's hearing officer who runs the telephone hearings on out of police report under executive branch or lacking PD on recording incident into written reports. The PD headquarters excuse the lack access to computer. A hotel has undesignated chamber lot. I don't see the court book. So most of these clerks are trying to explain the legal procedures in place for now, but it's not structured. Maybe it's just because of temporary tell COVID-19 aid has been in. So crimes happening unexpectedly. When crime appears uninvited and they put oil, judge, the hearing officer, I know they use facts and evidence. Oil, and they look. These criminals and they need all petition that it can. It's in favor to criminals, and they dismiss the case. But victims and when it's not fair that the Supreme Court about this thing. So maybe Attorney General can look into it and take care of this matter. It's very important to protect the people. About this. So this, in case, I'd like to ask you a request for my remaining time. Speaker, I had. And come back on mute.
Okay, that 2 minutes flat. Reserve time, Honorable Yellow Hair. That, let me go back to MAG.
Thank you, Speaker. Thank you, Daniel So, for the questions relating to both education and voting rights, and thank you for your leadership in both of those substantive areas. Just to point out, in the report on page 24, there's brief updates on both the Yazzie Martinez matter as well as the Impact Aid decision. And I know with respect to Impact Aid, there's in the report there, the state of New Mexico intended to appeal that DOE decision. And I know that our office here, both HSGU and litigation unit, is staffing that particular case, determining, and how the nation would intervene in that matter to protect the nation's legal interests. Alex provided a sort of up-to-the-minute report as the Yazzie Martinez hearing was happening, and so as I indicated before, we try to do that for these important matters where there's or procedural happenings in the cases that will impact the nation's interests. And so we were happy with the Yazzie Martinez decision. Regarding the question about voting rights and whether those rights apply to both the primary and general election, I know for the federal and state elections, the answer is yes. Regarding Navajo Nation tribal elections, I don't know the answer confidently, but I will have Catherine look into that and follow up with the entire council on that answer. I do want to share that this was a particular concern that went into the public health emergency order relating to what voting is going to look like on the Navajo Nation during the pandemic. And there was, some flexibility built into that regarding, recommending postponing elections, making sure there was proper PPE and, the ability, for folks to conduct voting in person safely. And there was a real recognition that, despite the pandemic, that there's a fundamental right to vote. And so I think that public health emergency order really tried to acknowledge that balance for people who want to vote in person. And I do want to share that apart from the federal, state, and Navajo Nation elections that happen on the nation, we also council for the San Juan Southern Paiute also reached out about that particular public health emergency order for their tribal elections during the pandemic as well. Regarding the questions raised by Honorable Delegate Stewart and the citations for COVID-19 and, the issues with respect to whether those are going to be enforced and if people are going to actually have to pay the fines, and certainly commend and acknowledge that the police department is doing a lot of extra duty with respect to, the public health emergency orders, the curfews, the weekend lockdowns, and trying to, do the checkpoints and issue citations for those violations, really in an effort to keep the Navajo Nation communities at large safe. And so for those citations that come in, our prosecutor's office reviews every single one of those, and they're prosecuting them. Some of the return dates for those citations are very far into the future, and so I don't know that we'll see for many of those citations an immediate response. I know that the prosecutor's office did get a 30-day jail sentence in Chinle recently, and we expect more fines and appropriate sentences for habitual offenders as we get into those court dates. But the ability to enforce those citations, is dependent on the courts hearing those matters to issue those decisions, because it's not an automatic fine, it's not an automatic jail sentence. Prosecutor's office has to prove the elements of those offenses. Most of them are criminal nuisance to the court, and then the court issues a decision on what whether the defendant will get a fine, a jail sentence, or both. And so I wanted to share that. And thank you to both Delegate Stewart and Delegate So for acknowledging our new hires. We are very happy to have them on board and look forward to them being positive and productive members of our team here, and to provide excellent legal services to the government. A Delegate Stewart asked a question about equipment and taking that home. And, I saw this provision in the code that's available on the council's website this morning regarding to property control. And I was looking for something else, but I ended up reading this provision today, and it sort of governs, Navajo Nation property and an employee's responsibility for Navajo Nation property. I can't find it in the code book because we were looking for that recently, or, as you asked the question as well. And so I don't know if this is a provision that is not current law, but I need to follow up on that. But I think that's sort of what would govern the folks taking their equipment home. And pre-COVID, all of our attorneys, all of our legal staff has laptops. We sort of don't traditionally work, even in a non-pandemic era, in an 8 to 5 sort of mode. Our attorneys are sort of on call for legal requests, at all hours of the day and throughout the weekend, trying to meet deadlines and be responsive to the legal requests. And so all of our attorneys had laptops to be able to take home. We had a few loaner laptops, or laptops that belong to staff that are no longer here, that we were able to assign to essential support staff that monitor, for example, the general email address for Navajo Nation Department of Justice, or who are, working on our budgetary matters. I think we have 3 support staff that have the loaner laptops at home to be able to continue working remotely, even though, and then they only come into the office on alternating days for limited hours. And then Delegate Brown asked a very important question about bootlegging, and I know this isn't a new issue, and I just want to say that, you know, I'm happy to meet about this. I will give you a commitment to work on this. You know, despite everything else that's going on, this is certainly an important matter. I was informed that there was legislation last term that was very strong for anti-bootlegging, and I want to look into that and invite you to also look into that with me. An appropriate legislation to read.
I really remember. Hold on, Madam AG. Colleagues.
What we were given.
Please mute your phones, colleagues. Thank you. Madam AG, go ahead, continue.
Sure thing. So, Delegate Brown, I make that commitment to you and to the leadership to work with you and take direction on updating those provisions and you know, working on that legislation with the Office of Legislative Counsel to have a stronger bootlegging system or anti-bootlegging system. And then Delegate Yellowhair asked about, you know, sort of, you know, crime is happening. This was a comment earlier from Delegate Crotty as well, and it's happening in some areas, domestic violence at an up spike. And I know that Delegate Yellowhair talked about the explanations about the legal procedures and how that's happening. And I just want to say that, you know, our Office of the Prosecutor is available 24/7 for any of these issues. And, you know, the ability to prosecute crimes, you know, depends on a lot of things, getting the reports, but also getting into court. And both of those things have been a little bit of a challenge during the pandemic. But one thing, and I mentioned this earlier with respect to the COVID-related citations, is that our prosecutor's office is staffing a phone line to answer questions, you know, not just about those COVID citations, but really about if there are questions about, you know, what's happening in the communities. I actually just referred an individual who reached out to DOJ, to the prosecutor's office today, just to get information on how to get a protection order. And I know that our prosecutor's office is happy to help folks and explain those procedures and processes and provide that information. And so I'll share the phone number here just so everyone has that. But the number to call is 928-206-7482. And I'll just repeat that. It's 928-206-7482. And that's staffed 24 hours a day, 7 days a week. So I think that's I think that was the extent of the questions. Thank you.
Thank you, Madam Attorney General. That I don't have anybody in the queue, so let me go back to reserve time.
Daniels here. Sure.
Well, Daniels, go ahead.
Yes, thank you, Chair. Speakers, excuse me. 24th Council, thank you for giving us an update report. Madam AG. Yeah, this is Herman Daniels, Council Delegate from Utah. I'm just wondering here, sitting here, what's the status on the Treaty of 2000 between the Navajo Nation and also the San Juan Southern Paiute tribes? I know that there's a tribe in Navajo Mountain, and also there's a group in Tuba City, Willow Springs area. So the last time we met was last year with the Party C and also the San Juan Southern Paiute council members. said, yeah, that's the last time we met. As of today, what is the status on that treaty, treaty of 2000, Madam AG? Reserve time.
Reserve time at 3 minutes, 47 seconds. Go back to you, Madam AG.
Thank you, Speaker, and thank you, Delegate Daniels, for the question. And our last discussion regarding the San Juan Southern Paiute Treaty was in February with the San Juan Southern Paiute leadership. And there were a lot of items discussed during that meeting, as well as some recommended follow-up. And if you recall, this case is also a pending litigation matter that also has been pending for many years, if not decades. And we had been operating with sort of 6 months extensions of the stay of the federal case. And the last extension was through June 30th of this year. I think that was reported to the council. And I think that we had committed to having some community meetings, both in Utah and around the Tuba City area, places that are sort of affected by the San Juan Southern Paiute Treaty area. And San Juan Southern Paiute actually reached out through their council, acknowledging the state of emergency and the pandemic, and suggested an extension of that 6-month period stay, understanding that there wouldn't be the kinds of community meetings to provide meaningful input from the people on the 2000 treaty. And so that's the current status, is that we're sort of just in, we did get an extension of the federal litigation, so that won't go back to court just yet, with sort of an extension to be able to have those community meetings when it's safe to do so, and then to work again with the San Juan Southern Paiute leadership on moving the proposed ratification of that treaty through the process, if that's the decision of the leadership to proceed in that manner. Thank you.
There are new individuals lined up. I'll move to them. Honorable Vice Chair Smith.
Good afternoon, Speaker, and thank you again. Attorney General, or Attorney, the rain out here. Oh, hear me? Am I breaking up?
You're breaking up.
Okay, well, let me try my best here. Question is to the Attorney General regarding recent CMY 4420 and the CJN 4720. We have two bases of laws. Which one do we actually go off of? Do we go off of CJN 47 or do we go off of CM 4420? And I keep hearing you can use 44, but however, use CJN 4720. Is there going to be an opinion on which one council should be using? And because we got the CARES Act money and we want to expedite that, we have an expenditure plan under CMY 44, and yet CJN 47 is still waiting for the three branch government to develop something so that they could get these monies expedited. We got 5 months, so people are waiting. That's my question, Speaker, and I reserve my time. Thank you.
Good question, Doy.
In 2 minutes, Speaker.
That, moving on down, Chairman Nez, floor is yours. Chairman Nez, you're up.
Speaker Damon?
Yes.
Can you hear me?
I can hear you, Chairman Nez.
Thank you very much. At this month, Speaker Damon, as well as the 24th Council, Madam Attorney General, Ms. McPaul, it's good to hear your report. Although, one question that I have that I really want answered, and I want my constituents along San Juan River to hear your answer and my question as well, and that is hemp legal or illegal on the Navajo Nation? That is my question. Thank you very much, and I reserve my time.
Serve your time at 4:25. Move on down, Honorable Eugene So, and then I'll come back to you, Madam Attorney General.
Yeah, Jay. On my grandpa's side, that is sure. Ask a question to the controller. I'm going to ask you the same question again, because I'm not really satisfied with the question, or she seemed like she was going around the bushes answering it in layman's terms. In regards to the CARES Act, the funds that went straight into the Navajo Nation bank. On the CARES Act, the language, and all those fancy language and how to use it and when to use it, what's not, what's good, what's good for it, and what's not. If the council delegate just push that CARES Act to the president with all his educated division directors and their legal counsel, and with the controller, which knows a lot about the CARES Act, how it should be used. If we just forfeit it to them and they take care of all that funds, would it been faster? That's what I ask her. Because it seems like today we're just going through all our chapter projects, and it's prolonging the usage of different funds. That's how I understanding it as thus far since three months, I think. So that's the question I really like to know. If you would just forward it to the president, let him take care of it. With all the money, how it should be used regarding to the act. It was already debated by Congress how it should be used. And we would have just did our thing, forwarded, let them take care of it. Would it have been faster if those laws does that? So those laws up is that's how I understand it, because we're prolonging this and our people are waiting out there. Thank you.
Okay, with that, we'll go back to you, Madam Attorney General.
Thank you, Speaker, and thank you, Delegates Smith and Nez, and so for the questions that you've posed. regarding the question from Delegate Smith about sort of how to reconcile both CMY 4420 and 4720 with respect to the expenditure plans, I think that they do provide different processes for expenditure plans. You mentioned that the 4720 requires a 3-branch meeting to come up with an expenditure plan, and you know, whether there will be, you asked if there will be an opinion on that. And, you know, I think that the memo that I mentioned that Nabi asked for, the report on the line item veto authority, will speak, I think, a little bit to some of these questions, and so I'll reserve the majority of my comments until we have an opportunity to talk about that memo. But what I do want to share here for everyone to hear is that I think that regardless of reconciliation of all of these sort of CARES Fund resolutions, is that I think that there's a common goal, not just among the branches, but among all of the executive branch programs, as well as all of the entities that are involved in planning projects and all of those sorts of things, to spend the funding for the benefit of the Navajo people. And so I really hope that in discussing all of these issues that we all understand, even though we're coming from different perspectives on this, or the same perspectives on this, that I think that we all share a common goal to use the funding to benefit the Navajo people. I'll talk about Delegate So's question next, even though, and I'll end with Chairman Nez's question, just because the CARES Act question relates to the comments that I've just provided. And I think the question was if the funds were pushed to the executive branch to plan and spend, if that would be a faster process. And I don't know that I have an answer to that. It seems like it would be a faster process. And I know that in your comments earlier, in your questions earlier, you acknowledged the expertise that exists within the various divisions and programs to be able to, determine the projects that would meet the criteria, as well as the timing needs that are set forth. So I would hope that it would be faster, but I don't know that for certain. What I will share is that with respect to, for example, the donation fund legislation, that's exactly what the council did, is establish the fund and then allocated the funding to the executive branch programs to spend and to report back to the committees. And the fund management plan that's required for that particular fund, sort of governs what the money can be spent on and how the reports will happen and all of those kinds of things. So this certainly is a different process than that. But I know that you're asking particularly about timing, and all I can say is that I would hope it would be faster. I think that we know the current process has taken several weeks, if not a couple months, to get to a point where funding can be spent. And I guess that's all I want to say on that. I don't have a more definite answer for you. I apologize, Delegate. But those are my thoughts. And then with respect to Chairman Nez's question about the legality of hemp. So let me share this. Hemp is not legal. Its cultivation is a civil offense. And we've reported to the committees, the RDC and to NABI, on the pending civil litigation related to hemp cultivation along the San Juan River. And I mentioned in my opening comments that we do want to have a work session with NABI and with RDC on hemp, and there is a large portion of that report that can be shared publicly. And so we look forward to doing that report to the public as well as to NABI. Thank you.
Thank you. I'm Attorney General. That we don't have anybody lined up in the queue, so I'm gonna go back to reserve time. Honorable Keon Begay, 4 minutes and 14 seconds. Honorable Keon Begay. Once. Honorable Keon Begay. Twice. Keon Begay, 3 times. Moving on down. Madam Chair, Amber Crotty, 2 minutes, 34 seconds.
Thank you. I didn't, can I get I'm sorry if I missed the answer. What is the status of hiring a Chief Justice? And I'll reserve my time. Thank you, Speaker.
Reserve your time at 2 minutes and 27 seconds. That. Moving on down. Honorable Brown, 1 minute, 3 seconds.
I'm sorry, Chief Prosecutor. I apologize, colleagues, and Ms. McCall.
Thank you, Speaker.
Go ahead.
Okay, well, the main thing is, thank you, Madam Attorney General Dorian McPaul, for your response. I look forward to reaching out, send an email, and then maybe we can schedule a conference call. We can get Chief Francisco, Mr. Delmar, acting prosecutor, and others, so we can make this happen. And then I've been talking to the county sheriffs as well here in Navajo County and Apache County, if we can get them involved, and also the FBI. And then also, I think we need to set a meeting up with the Arizona, New Mexico, and Utah State Liquor Department and see how we can and other alcohol being transported to the Navajo Nation. And we do to help our cops, and here in my communities, we've been doing that. So we just want to help them out. We know that they can get overwhelmed and understaffed. So we can go ahead and work on that as well. So thank you, Speaker. Thank you, Shananta. And I'll waive the rest of my time.
Thank you, Honorable Brown. Moving on down, Honorable Jimmy Hill here, 2 minutes.
Waive my time to anyone who wants to use this, if that's possible, Speaker.
Okay. Nobody? Nobody. Okay, that. Moving on down, Honorable Herman Daniels, 3 minutes, 47 seconds.
Thank you, Speaker. Board Council, I'm going to want to say thank you to Madam AG for doing her report to the Navajo Nation Council, update report. And I know we had questions here and there, but most of the questions were answered. And my question relating to the treaty of 2000 between the Navajo Nation and San Juan Southern Paiute Tribe, it's been answered. So really would appreciate we go out to the communities and get input from the leadership at the local level, from Nassau chapter and also Tuba City chapter. Yeah, those are the chapters that are adjacent to the tribes out there. So I would really appreciate that we go out there and listen to our Navajo leadership out there, local leadership. So yes, Speaker, I want to say thank you again and wait my time for this. Thank you very much.
Thank you. Okay, with that, Honorable Daniels. We go on to Vice Chair Smith. 3 minutes and 38 seconds.
Thank you, Otto AG. Thank you for that clarification. I'm hoping that we can get an opinion as soon as possible, because right now we're in limbo. I look at both of them, and the other one is superseding the other one according to his opinions, various thoughts. We need to have a straight answer so that we can get these funds expedited rather than trying to say that this one's what we're supposed to use. This one's the law of the land. This one has been vetoed. It's confusing. And for the people, because is concern go right. And heard earlier that you're not too familiar with the primary and general. I know we have to have a general. And should we do the override and step over to primary, I hate to be voting for something that I am actually breaking the law. So could you have something to the council before we entertain that veto override so that we know where we're standing at, so that we can do it correctly? I think the election office should be well aware of these laws, because they're the ones that were the council.
You're breaking up, Honorable Vice Chair Smith. Vice Chair Smith, lost you.
Oh, darn it. Sir, I was saying that the election, wonder if AA can give us
You keep breaking up, Vice Chair Smith.
let me try this again. Can you hear me now?
Yes.
Can you hear me now? Okay,
Yes.
Speaker,
Can't hear you, Vice Chair. And once. Twice.
Can you hear me now? Can you hear me now?
Yes.
Okay. Make it short. Would like to have an opinion on the primary that before the veto override. so that we're not breaking the law, to make sure we do not infringe upon the voters' rights. Because if we have to do the primary, then let's stay with the primary. If we don't have to do the primary, we can go to general. And that speaks. Thank you.
Vice Chair Smith, we just lost you.
Speaker.
I can't hear you, Vice Chair Smith. You had to stand on your roof or something.
Speaker, I'll go ahead and text that to your office, what I was requesting for.
Okay.
Thank you.
Okay. Moving on down. Honorable Chairman Rick Nez.
Speaker Damon, thank you very much, but I think I'll waive my time. Thank you. My question has been answered. So thank you, Attorney General, Madam McCall. Thank you.
Okay. Let me go back into Madam Attorney General.
Thank you, Speaker, and thank you, delegates, for the follow-up questions there. Delegate Crotty asked about the status of the hiring for the chief prosecutor position, and I did share that position is advertised. We don't have any applicants for that position, and I shared that we spent a lot of time with DPM to get the JVA for that position updated because it did not include the statutory requirements for the chief prosecutor position that are in the code. And so we had that added, and that position is advertised. Delegate Brown, I think it was just mostly comments to reach out to schedule a conference call with the Navajo Nation justice providers, and I'm committed to that. I think it is important that we meet internally to have a position that we can, express when we have the external meetings, to include the county sheriffs, the FBI, and the state liquor departments. But I am committed to working on that with you, Delegate Brown. Delegate Daniels, regarding the treaty and the meetings to get input from the communities, I certainly support that. I think one thing that my office can commit to doing to help with those efforts to get input from the communities is we can help prepare a sort of informational sheet that outlines, what the issues are with respect to the treaty, and certainly we'll have the delegates review that before it goes out for public consumption. But I think that's a good way to at least get the information out on what's going on with the treaty and the litigation for that case, and sort of the decision that's presented to the council regarding that treaty. And so I'm happy to put that sort of informational sheet together that can be distributed to the communities. And depending on how long the pandemic lasts and the ability to meet and get community input in the way we're used to getting community input, one thought also is to provide an opportunity for folks to submit their input electronically as well. I mean, it's not the same as face-to-face contact and being able to ask questions and follow-up questions and get answers and those kinds of things, but it's at least a way to educate people about what the issues are, and then if they want to provide input, to an opportunity and an avenue to do that. So if that's something that you think might be helpful, Delegate Daniels, just let me know, and we are happy to put that together. And then regarding Delegate Smith's question, I agree that, I could not agree more that what is going on now is very confusing. It's confusing, I think, not just to the leadership, but also to our clients. OMB has been asking for direction, and it's confusing to the lawyers who are supposed to be able to make sense of the laws and the changes and everything that's occurring, so that we can provide that guidance. And so, as I said, I could not agree more that it's confusing. And I understand the need for clarification, and I hope that the report that we provide will help sort of guide evaluating those resolutions. And I want to emphasize what I said before, that regardless of the confusion, I think that the goal remains the same, to spend the funding for the benefit of the Navajo people. And then I think there was a question related to the veto of the legislation canceling the primary election, and I don't think that particular legislation was line item vetoed, but it was vetoed. And I know that Delegate Daniels asked a question regarding voting rights and whether those applied to both primary and general elections, and I committed to having Catherine follow up on that. And so she's aware of that, and I hope to provide some information to the council here promptly. Thank you.
Thank you, Madam AG. That's new individual on the board. Madam Chair, Charles Newman. Go ahead, the floor is yours.
Thank you, Speaker. And also thank you, Ms. McPaul, for your presentation. You're always very thorough in what you present. I want to kind of go back to the question of that was presented to you by Honorable Nance regarding hemp. I guess my confusion is if hemp is not legal, why hasn't there been any arrests made? And the other question that I have is, where is hemp violation listed in Title 17 if it's not legal? And I asked that question because we had an order committee where we did talk about this issue, and we were informed that hemp was not illegal, but it wasn't legal either. And yet you mentioned a civil infraction and state that hemp is not legal. To me, when you say hemp is not legal, I'm expecting it to be in Title 17 with the violation, a definition of the violation, and also I guess the infractions that would also be included in there. So I'm a little bit confused because I thought the issue rested on the regulations. So maybe I would just suggest a statement from your office to clear up some of these confusions. In addition, Speaker, I'd like to ask that a statement from your office also regarding this matter be issued as well, because it's a little bit difficult. As a delegate, we have been advised both on and off the record that we cannot discuss this case. And we're getting all of this conflicted information. And I think it would be a good idea to set the record straight regarding this issue. I think a lot of people are interested in knowing the answer to this. And I issued a statement based on what I was informed at Law and Order Committee, and based on my research in Title 17, not seeing it in Title 17. But I guess I stand corrected on that. And if you could let us know where it's stated in Title 17, I would really appreciate it. Also, in regards to CMY 4420, I believe there were two Navajo Nation Department of Justice attorneys who stated on the record that CMY 4420 was law. So I want to know what has changed that requires this new consideration as far as whether CMY-44-20 is considered law. I believe that that's what council was told, and many of us are still kind of in that mindset, which is why I believe Honorable Raymond Smith is asking that question for clarification regarding CMY-44-20. So those are my questions. I reserve the rest of my time, Speaker. Thank you.
That, Madam Chair, Charles Newton, serve time at 1:53. I don't have anybody else on the board. Let me go back for a second round of reserve time. Keelan Begay. Okay, you there now? 4 minutes, 14 seconds. Going once. Keelan Begay going twice. Keelan Begay going 3 times. That, moving down, Honorable Madam Chair, Amber Crotty. 2 minutes, 27 seconds.
Thank you, Speaker. Colleagues, I appreciate Ms. McPaul for repeating that. I think what I would need from your office then is what is the plan in terms of, and I'm curious, and I would want to know from other attorneys why they're not applying for the chief prosecutor position. I don't know in terms, can you hear me?
Yes.
Oh, great. So I would need to know why, or in your opinion, why you're not receiving applications for the chief prosecutor position, but it appears that you're able to fill other vacancies. And in that same vein, I would like to know where we're at with the white collar unit. I would participate in the work groups where we would discuss some of the challenges to quell and to prevent white collar crime and make sure individuals would pay their fines. So I'd like to get that information. And on page 21, you mentioned the proposed Navajo Nation Washington office acquisition. If you could provide an update in terms of I have not, and I could, or if someone can resend the details of this acquisition, and I'll reserve my time. Thank you.
102. Reserve your time, Madam Chair. 1 minute, 2 seconds. Let me go ahead and go back to Madam AG. Madam Attorney General, the floor is yours for response.
Thank you, Speaker, and thank you, Delegate Charles Newton, for the questions there and clarifications needed regarding hemp and Title 17 specific questions. So hemp is not under Title 17 as a criminal offense. Hemp is prohibited civilly under CMY 3320. And so the distinction is between a civil issue and a criminal prohibition, criminal offense. So it's not in Title 17. What is in Title 17 is that marijuana is illegal, and marijuana has to have a THC content of 0.3%. And so anything less than the 0.3% is hemp. And so hemp is not a criminal offense under Title 17. But just to be clear, it is prohibited. Hemp cultivation is prohibited under most recently CMY 3320, but that's a restatement of previous resolutions as well. And so we are happy to provide an issue a clear statement on that, and so we will certainly work on that and have that sent out. There was a question, follow-up question about 4420 and the participation of the Department of Justice regarding that legislation, and it being the law. And so I do want to share that we were involved in the drafting of that legislation. The Chief Legislative Counsel has been very, there's been a cooperative relationship in many of these legislations because, for example, the Department of Justice representing the Office of the Controller, or OMB, there's a lot of overlap in what goes into the legislation and then what the requirements are with respect to the executive branch departments under those legislation. And so we do have a cooperative working relationship with respect to legislation. And so, and we were operating under the, assumption that law was valid. I mean, working with the Budget and Finance Committee on, various matters with OMB and with OOC. And I think where the reevaluation of that particular legislation came into play was with the veto of the veto message of 4720 and the line item vetoes of references to 4420 in that that message. And so we're certainly looking at the message there and reevaluating,
This conference
what
has
has
reached its maximum
transpired
duration and will end in 1 minute.
with respect to all of those legislation. And then Delegate Crotty asked a question regarding the chief prosecutor position and why folks are not applying for that position when we are, when we're filling other, we're able to fill other vacancies. And
Madam AG,
yes,
I'm gonna have to stop you right there before you, colleagues. We are going to have to shut down this line and then call back in. Sorry to mess you up, Madam AG. But if you could call back in, 24 Navajo Nation Council members of staff members, if you could please call in. We are going to lose this line in about
Goodbye.
Hey, no, Craigie, Taylor with Art last week. Hay cigarette now, don't you? So, oh, then.
Colleagues, is this the right line?
Yes.
I hope so.
Oh, good. Thank
Yeah.
you. Good to hear.
The others on the line too. Have we come back on?
Speaker, this is Daniel on the line.
No, Herman. How's it going, buddy?
Thank you, colleagues. Live, ready to go again. Just do a recap for the record again. Today's date is July 21st. Time now is 8:24 p.m. We are still on the Attorney General's report. We do have a motion by Honorable Otto So, second by Honorable Herman Daniels. In the when we left off, Madam AG was giving a response, so we can go back to that right after roll call. Mr. Bell, if we're going to go ahead and do roll call this evening, that'd be great.
Honorable Elmer Begay. Honorable Elmer Begay. Honorable Elmer Begay did not vote. Honorable Kealan Begay Jr. Honorable Kealan Begay Jr. Honorable Kealan Begay Jr. did not vote. Honorable Paul Begay Jr.
Delegate Paul Begay is present.
Are we doing roll call? Speaker, are we doing roll call?
Yeah.
Oh.
Yeah, we're just doing them.
Honorable Nathaniel Brown. Honorable Nathaniel Brown. Honorable Nathaniel Brown. And answer roll call. Honorable Eugenia Charles Newton.
Charles Delegate Brown is here.
Present.
Honorable Eugenia Charles Newton. Answer roll call.
Thank you.
Honorable Amber Kanasakrati.
Delegate Amber Kenneth-Crotty is calling in from Sheep Springs, Navajo Nation. Thank you.
Honorable Amber Kanasakrati. Answer roll call. Honorable Speaker Damon.
Present.
Honorable Herman Daniels Jr.
I'm here.
Honorable Herman Daniels Jr. Answer roll call. Honorable Mark Freeland.
Present.
Honorable Mark Freeland. Answer roll call. Honorable Pernell Halona.
Halona is here. Present.
Honorable Pernell Halona. Answer roll call. Honorable Jamie Hanyo.
Henyo's here.
Honorable Jamie Hanyo. Answer roll call. Honorable Vince James.
Delegate James present.
Honorable Vince James. Answer roll call. Honorable Ricky Nez.
Delegate Nez is here.
Honorable Ricky Nez. Answer roll call. Honorable Carl Slater. Honorable Carl Slater. Honorable Carl Slater does not answer roll call. Honorable Raymond Smith Jr.
Present.
Honorable Raymond Smith Jr. Answer roll call. Wilson Stewart Jr.
Present.
Honorable Wilson Stewart Jr. Answer roll call. Honorable Otto So.
I'm here.
Honorable Otto So. Answer roll call. Honorable Charlene So.
Present.
Honorable Charlene So. Answer roll call. Honorable Daniel So.
Daniel So is present.
Honorable Daniel So. Answer roll call. Honorable Eugene So. Honorable Eugene So. Honorable Eugene So did not answer.
Here.
Honorable Eugene So answered roll call. Honorable Thomas Walker Jr.
Thomas Walker is present.
Honorable Thomas Walker Jr. answered roll call. Honorable Edison Winika.
Here.
Honorable Edison Winika answered roll call. Honorable Edwin Yazzie. Honorable Edwin Yazzie. Honorable Edwin Yazzie did not answer roll call. Honorable Jimmy Yellowhair.
Honorable Jimmy Yellowhair is present.
Honorable Jimmy Yellowhair answered roll call. Going back up. Honorable Alma Begay.
Present.
Honorable Alma Begay answered roll call. Honorable Kealan Begay Jr. Honorable Kealan Begay Jr. Honorable Kealan Begay Jr. did not answer roll call. Honorable Nathaniel Brown.
Delegate Brown is here from Navajo, Arizona.
Honorable Nathaniel Brown answered roll call. Honorable Carl Slater.
Delegate Slater is present.
Honorable Carl Slater answered roll call. Honorable Ed Niazi. Honorable Ed Niazi. Honorable Ed Niazi did not answer roll call. With that, Mr. Speaker, you have 22 members that answered roll call. Mr. Speaker.
Delegate Keelan is here.
Honorable Keelan Gay also answered roll call, Mr. Speaker. So with that, you have 23 members that answered roll call, Mr. Speaker.
Thank you. Well, 23 members here this evening. You have a quorum. Continue on down. Madam AG, go ahead and continue. The floor is yours and the response. Sorry again for interrupting you.
No problem, Speaker. Thank you. I was answering Delegate Crotty's question about, why there are nobody's applying for the chief prosecutor position, and we seem to be able to be filling other positions and other vacancies. And I just want to share that, with respect to, for example, just with our recent hires in this past quarter, none of those folks would meet the requirements of the chief prosecutor position, despite the fact that, one of them has over 2 decades of experience and was a former prosecutor. And part of the reason for that is because the statutory requirements for the position include, it has to be a Navajo member, and they have to have resided on the Navajo Nation for 6 months prior to their appointment. And so for folks who don't already live on the nation and work for the nation or for some other legal services provider on the nation, that really limits the pool of people that qualify to even apply for the position. And that's the only position, not just in the Department of Justice, but in the entire nation that has those types of